Mr. Chair, what
Yeah.
is the appropriate the same reason. We care. And we ask everyone to observe the culture of respect that we have here for every single person. All who have signed up to testify, and we have many, will have an opportunity to speak, and we very much look forward to hearing from you. But we ask that when it is your turn, you please limit your remarks to 2 minutes. This is for our advocate panels, so that we can have an opportunity to hear from everyone that has signed up. For those that require a little bit of extra time due to any kind of technology needs, we will absolutely make accommodations as necessary on a case-by-case basis. And so just for an overview for the process for today, we always start our budget hearings hearing from our nonpartisan Department of Legislative Services budget analyst, and we're going to invite her to the table, Ms. Victoria Martinez. Please join us. And she will share an overview of her nonpartisan analysis of the administration's proposal. After that, we'll hear from the department on their proposal. In between each, of course, I forgot, members here will have an opportunity to ask questions. At the conclusion of our questions with the department, we'll then hear from advocates. If needed, as we did last year, we might ask the department to come back for an ability to respond, but we'll leave that up to sort of how things go. We'll let you all know towards the end if that happens. But we are going to be here. We are here to listen, and we welcome all of you. So thank you for being with us. And you may begin, Ms. Martinez. Thank you.
Thank you, Madam Chair and members of the committee. My name is Victoria Martinez, and I'll be going over the Developmental Disabilities Administration, or DDA's, budget analysis today. DDA provides services to individuals with intellectual and developmental disabilities, primarily through community-based services. As you can see on the first page of the analysis, the fiscal 2027 allowance decreases by $542 million, or 14%, for a total of $3.3 billion. Since these spending trends include cost containment and a deficiency that adds funding to 2026 to cover spending in 2025, Exhibit 1 on page 3 more accurately shows spending trends. From 2026 to 2027, the community services budget decreases by 4% when including cost containment, but increases by 4% when excluding cost containment. Moving on to the discussion of the Managing for Results performance analysis. The first MFR, beginning at the bottom of page 5, discusses DDA's goal of increasing enrollment in their Medicaid waiver to allow DDA to claim federal funds for services. DDA previously operated 3 waiver programs, but as of October 2025, DDA consolidated their waiver programs into one waiver, the Community Pathways Waiver. Exhibit 3 on page 7 shows that enrollment increased to a total of 19,158 participants served in the waiver in fiscal 2025, which is 90% of the total slots that DDA was authorized to fill. The second MFR, beginning on page 8, discusses waiting list placements. Exhibit 5 on page 9 shows that the number of individuals waiting to receive DDA-funded services decreased by 15% to about 3,400 in 2025, showing improvement in decreasing the waiting list. And the last MFR measure, beginning on page 9, discusses performance in meeting 3 goals relating to timely review of person-centered plans, or PCPs. Exhibit 6 on page 10 shows that performance decreased in 2025, with only 62% of plans submitted by coordinators of community services submitted in a timely manner. Since participants need an approved plan to receive services, timeliness is very important. So DLS recommends adopting narrative, requesting more information on PCP review processing times and efforts to improve timeliness. Moving on to the discussion of the fiscal 2025 budget, beginning on page 11. In fiscal 2025, DDA reported a total shortfall of $356.6 million, and the deficiency adds funding to fiscal 2026 for this purpose. DDA also submitted a report on advance payments given to assist providers in their transition to LTSS. And Exhibit 7 on page 13 shows advance payments and recoupments with a total of $2.3 billion of advance payments provided, most of which have been recouped, but DDA should comment on when the recoupment process will be complete. DLS also determined this report to be in compliance with the budget language and recommends that withheld funds be released, and will process a letter to this effect if no objections are raised during the hearing. Fiscal 2025 also included a large increase in spending from the Waiting List Equity Fund. As shown in Exhibit 8 on page 14, the fund balance had accumulated in recent years, but because of a change in the BRFA of last year, the balance was completely expended in 2025. Moving on to the fiscal 2026 budget, beginning on page 14, the fiscal 2026 budget added $34 million general funds for 2025 and $147 million general and special funds for 2026 to partially restore funds for cost containment actions. The bulleted list beginning at the bottom of page 14 and onto page 15 shows the funding added to modify or fully restore funding for actions in 2026. In addition to the $356 million deficiency for fiscal 2025, there's also a $380 million deficiency for shortfalls in 2026. There's also a fund swap that provides $17 million in special funds from the Community Services Trust Fund, which is estimated to be the full balance of the fund, to provide an equivalent amount of general fund relief. However, $15 million from this fund was transferred for cost containment in fiscal 2026, so the fund does not seem to have sufficient balance to support the deficiency, and DLS has asked DDA to discuss plans to replace the $15 million general fund need. The last thing to note on fiscal 2026 is that there's a decrease of $169 million from 2025 to 2026. Exhibit 9 on page 16 shows the components of spending change, and although a portion of this decrease is due to cost containment actions, it's unclear why the budget decreases further, so DDA should discuss the reason for this decrease and any concerns about the fiscal 2026 budget. Moving on to fiscal 2027, Exhibit 10 on page 18 shows an overview of agency spending in fiscal 2027. About 98% is for provider payments in the Community Services Program, most of which is for residential services, followed by meaningful day services and support services. The remaining 2% includes spending for utilization review services, regional offices, and other operating expenses. And Exhibit 11 on page 19 shows this spending by service model. Exhibit 12 on page 20 provides a breakdown of the $542 million decrease from the fiscal 2026 working appropriation to the fiscal 2027 allowance. Most of this change is within the Community Services Program, and Exhibit 13 on page 22 shows the primary spending components. The budget includes increases of $76 million for service utilization growth and $74 million for new enrollment, but these increases are offset by larger decreases of $356 million to remove the deficiency for 2025 and $299 million in cost containment actions. To better understand service utilization, which is the biggest increase in the budget, DLS recommends adding language restricting funds pending a report on utilization trends. In terms of personnel that's discussed beginning on page 23, there's a slight increase in contractual positions in the fiscal 2027 allowance. The vacancy rate remains high with 28 vacant positions, which are shown by program and position type in Exhibit 14 on page 24. Since most vacant positions were developmental disabilities program coordinator positions, DDA should discuss the impact of these vacant positions on PCP approval times and efforts to improve recruitment. The first issue, beginning on page 26, discusses community services spending growth. Exhibit 16 shows actual community services spending compared to the original legislative appropriation, showing that spending has increased rapidly in the community services program. Spending has more than doubled in a 3-year period from $1.7 billion in 2022 to $3.6 billion in 2025. Most of this spending was not originally budgeted for in the legislative appropriation and required significant deficiencies in subsequent years to cover the shortfalls. Exhibit 18 on page 28 shows what drove the spending growth. This was primarily due to costs related to the transition from a prospective payment model to a fee-for-service billing system in LTSS. The LTSS transition led to about 18% higher overall cost for 2 main reasons. The first is higher rates that were incorporated into the LTSS rates that were based on a rate-setting study, and the second is increased utilization over time due to additional flexibility in service billing. The budget also increased due to various provider rate increases that were costs that were expected and budgeted for, which are listed in Exhibit 20 on page 30. The next couple exhibits have spending trends for fiscal 2025, which was the first year in which all providers transitioned to LTSS. Exhibit 21 on page 32 shows spending by service, with 4 services: community living, group home, personal supports, dedicated hours, and community development, accounting for 85% of total spending. Exhibit 22 on page 33 shows participants served, and Exhibit 23 on the next page shows cost per participant by service type and service model. Exhibit 24 on page 35 shows more detail on cost per participant by specific services and service model. It's important to note that cost per participant varies widely for participants, both within and across service models, because plans for receiving services are very tailored to each participant's needs. Data from DDA's second quarterly spending report shows that spending in the first quarter of fiscal 2026 totaled $839 million. DLS determined this report to be in compliance with the budget language and recommends that withheld funds be released. And DLS also recommends adding language restricting funds pending quarterly reports with updated spending data to continue monitoring spending. The second issue, beginning on page 36, is on cost containment implementation and cost neutrality. DDA submitted a report on the implementation of 7 cost containment actions in 2025 and 2026, which are summarized in the bulleted list on page 37. And Exhibit 25 on page 38 shows the updated savings from these actions, showing that general fund savings were $9.9 million lower than originally estimated. This issue also describes in more detail the implementation of state-only funded services action, which is summarized in Exhibit 26 on page 39. As of the report, 136 participants were removed from services due to this cost containment action. DLS determined this report to also be in compliance with the budget language and recommends that the withheld funds be released. For fiscal 2027, there are 4 proposed cost containment actions in the allowance, which are summarized in Exhibit 27 on page 41. 2 of the cost containment actions would impact self-directed service participant employee wages by modifying the reasonable and customary wages to align with BLS wages and also eliminating the wage exception process to pay higher wages. Exhibit 28 on page 42 compares the current reasonable and customary wages to the BLS wage, and wages for all services would decrease except for employment services and support broker services, which would increase. Although the BLS wage is one component used to develop traditional provider rates, traditional providers have flexibility in paying above or below the BLS wage. So DLS has asked DDA to provide average wage paid to employees in the traditional services model to better understand how wages would compare. Another cost containment action implements a cap of $500,000 on PCP budgets and is estimated to impact about 1,600 participants. And Exhibit 30 on page 44 shows the range by which participants exceed the proposed cap. To monitor the implementation of cost containment actions implemented, DLS recommends adding language restricting funds pending a report on the implementation of these cost containment actions. And the last thing I'll discuss is cost neutrality, beginning on page 45. Since DDA provides services through a Medicaid waiver, they must meet certain federal requirements, including demonstrating that the cost per participant to provide services through the waiver is at least equal to or less than the cost to Medicaid in operating institutional programs. Exhibit 31 on page 46 shows this cost neutrality calculation. As shown, the gap between the two decreases significantly in 2026, and this is mainly driven by a decrease in the estimates for institutional costs based on a revised methodology. To summarize the DLS recommendations, DLS recommends adding language restricting funds pending reports on community services spending, utilization trends, and cost containment implementation, in addition to adopting narrative requesting a report on PCP review timelines. DLS also recommends restricting funds in the community services program to that purpose only. And that concludes my presentation. I'm happy to take any questions.
Thank you so much, Ms. Martinez. We really appreciate your thoughtful and thorough analysis as always. Do any members of the subcommittee or any of our special guests have questions of our analyst? Okay, seeing none, we thank you. Oh, I'm so sorry. I'm sorry, I cannot see that microphone. Delegate Ruff, please.
Thank you so much. One of the things that we're obviously trying to figure out a solution for is the growth rate that you discussed. Do you have an understanding of, based on the growth rate right now, what the projection would be for the DDA budget in several out years, maybe 3 to 5 years from now? What does that look like? If not, you can, obviously, we can talk about it at another time.
Yeah, we do try to forecast cost of services in future years and the out years for DDA. Most of the growth from 2022 to 2025, and this was primarily due to the LTSS transition. And so that's why the budget increased so much in those years. We anticipate that the growth in out years wouldn't be as significant in the out years now that all providers have transitioned to LTSS, but it's still something that we continue to monitor to see how particularly utilization trends might develop in the out years.
Thank you.
Thank you so much, Delegate. I apologize again for not being able to see your microphone. And Delegate Stanko for a question. Whitney, can you please get Delegate Stanko? Thank you.
Thank you. Thank you, Madam Chair. On Exhibit 23, which is the cost per participant by service type and model, if I understood your comments correct, I want to make sure I did. That's and in the actual notes, the cost for self-directed is about $7,000 per participant more. Is that right? And in residential specifically?
Yes, in residential. I'll also note, though, that's, so overall, the cost per participant, just in the total budget, the self-directed cost per participant is lower than the traditional services model. However, that varies when you break it down by the different service categories. For residential, it is higher, but I'll also note this was, I think only two participants, or very low number of participants in self-directed received residential services in 2025. And so although the cost is a little bit higher, the overall cost of residential services is primarily in the traditional services model, because significantly more participants receive that service in the traditional model compared to only about 2 or so participants in the self-directed services model.
Thank you. And just one quick follow-up on that. So the numbers that are presented, are those actual dollars spent or budgeted dollars?
That's actual spending.
Thank you.
Mm-hmm.
Thank you, Delegate. Thank you, Ms. Martinez. We really appreciate your thoughtful responses. Thank you. We will now call our MDH team to join us. Secretary Seishamani and team, welcome. You may join us at the table, bring whoever you wish. And thank you, Ms. Martinez. You usually join us up. You can sit right next to Joe. Thank you. Not anymore. No, Joe needs to be next to me. Sorry. Okay. Little musical chairs, friends. Sorry. Thanks.
Wonderful. Well, good afternoon. Well, Speaker Pena-Melnick was here, Speaker Pro Tem Clippinger, Chair Barnes, Chair Shetty, and members of the Health and Social Services Subcommittee. For the record, I am Dr. Mina Seishamani, Secretary of Health for the state of Maryland. The department thanks the governor, the Department of Budget and Management, and the budget committees for their support. And we thank the Department of Legislative Services for its insightful budget analysis of the Developmental Disabilities Administration. I'm pleased to be joined today by Deputy Secretary Marlena Hutchinson and members of the DDA team to discuss the fiscal year 2027 budget. As you know, the Maryland Department of Health has the incredible privilege of serving Marylanders across their lifespan, from their birth until their final moments. And we are working every day to protect and advance the health and well-being of all Marylanders. Disability services are central to that mission. This includes providing access to a wide range of services that allow Marylanders with intellectual and developmental disabilities to live the lives they choose. The fiscal year 2027 budget is a measured proposal focused on funding services today, as well as protecting the long-term sustainability and existence of the DDA program into the future so that it can continue to serve Marylanders with intellectual and developmental disabilities. The budget includes $3.2 billion in total funds for DDA, including $1.7 billion of general fund support. This reflects an increase in state funding of more than $920 million during the Moore-Miller administration. Our goal is to maintain an accessible, equitable, effective, and sustainable program of meaningful services that promotes community living through both self-directed and community provider-managed delivery models. The Community Pathways Waiver Program that covers many Marylanders with intellectual and developmental disabilities operates under federal waiver authority, that must remain grounded in services, financially sustainable, and compliant with federal Medicaid rules. Now, we are in a challenging time. As we have put together the budget proposals that we are here to discuss today, our engagement with the disability community has been crucial in order to better understand how these services can best support people and their families now and in the future. Last year, the DDA team participated in more than 100 community engagement events and engaged in 41 workgroup meetings to collect feedback about program sustainability. And DDA has also regularly met with representatives and participants from both the self-direction and the community provider-managed delivery models. And DDA will continue to host hybrid and in-person meetings with community partners both during and after the legislative session. The fiscal year 2027 budget sustainability items are needed to keep the Medicaid waiver program approved, funded, and operational. Without sustainability actions, the state would face a threat to its Medicaid waiver and escalating deficits, threatening provider stability, service continuity, and a wait list that continues to grow without moving people into services. Our mission through all of this remains the same: to serve Marylanders with intellectual and developmental disabilities now and into the future. So thank you for providing me with an opportunity to highlight the Developmental Disabilities Administration and the work that we all do together to continue to protect Marylanders. We look forward to working with you, the Maryland General Assembly, with advocates, with the community, as together we pursue our collective vision of a high-quality healthcare system that really produces the best possible health for Marylanders across their lifespan. So with that, I will turn it over to Deputy Secretary Hutchinson and the team to address the specific budget questions. Thank you so much.
Good afternoon. Thank you, Madam Secretary. Good afternoon, honorable speakers, honorable chair members, as well as the budget committees. The department thanks the governor, the Department of Budget and Management, and the budget committees for your support. We also thank the Department of Legislative Services for your insightful budget analysis as well. I am going to go into the specific questions from DLS and provide DDA's responses. So on page 11, in accordance with the importance of timely PCP or person-centered plan reviews and participants' access to services, the Department of Legislative Services recommends adopting narrative requesting a report on PCP review times, including the impact of delayed PCP approval on a participant's access to services and any efforts being taken by DDA and its case management entities to improve timely PCP submission. The department concurs with this recommendation. Next, DLS determined the report on fiscal closeout and advance payments to be in compliance with the language and therefore recommends that $500,000 in withheld general funds be released and will process a letter to this effect if no objections are raised here. The department thanks DLS for its review and the recommendation to release the withheld funding. We are very proud because in less than 2 years, the original $468.6 million in advance payments due to the department, of that, approximately $422.6 million has been collected or is in approved payment plans, representing almost 90% of the total balance. Of the 255 providers that received reconciliations, 179 have entered into a payment plan or are in active appeals with the Office of Administrative Hearings, or are no longer carrying a balance owed to the department. We also have some providers actively negotiating with the department. DDA anticipates resolving the remaining balance by the end of this fiscal year, 2026. Next, DLS asks that we comment on the current fund balance of the Community Services Trust Fund and whether the fund has a sufficient balance to support the transfer of $32.6 million in fiscal year 2026. DLS also asks if of our plans to work with the Department of Budget and Management to replace the $15 million in general funds needed. The current fund balance is $17,770,528. We are working with our DBM partners on a supplemental deficiency to adjust the current year special fund appropriation for this item to better align with available revenue. Next, DLS asks for the reason for the decrease of $127.8 million in fiscal year 2026 and whether higher spending is anticipated in the second half of fiscal year 2026, including any concerns regarding the sufficiency of the fiscal year 2026 working appropriation. In fiscal year 2025, DDA spent $3,223,731,693 in total funds, which, when you combine it with the Schedule F deficiency of $356,572,170 for fiscal year 2025 claims, this totals $3,580,303,863 in total funds. There are a number of factors that impact expenditure changes between fiscal years, and we would like to note that these expenditures include approximately $237,945,856 in claims from previous fiscal years that lacked fiscal year 2024 accrual support, and they were therefore paid in fiscal year 2025. Reducing fiscal year 2025 expenditures to account for expenditures tied to prior service claim years resulted in a reduction of fiscal year 2025 expenditures. And so we're at $3,342,358,007. In comparing the revised fiscal year total of $3,342,358,007 to the proposed fiscal year 2026 budget of $3.4 billion, we now see an increase in costs rather than a decrease. This increase reflects approximately a 2% growth and 4.33% without fiscal year 2026 cost containment. And this is in line with DDA's expectations for annual expenditure growth. It's also very important to note that we are continually refreshing our projections as new Medicaid paid claims data come in. DDA will continue to work with its partners at DBM to continue reviewing our fiscal year 2026 projections in the event service utilization increases in the second half of fiscal year 2026. Next, to better understand and monitor service utilization trends, DLS recommends adding language restricting funds pending submission of report utilization trends in LTSS Maryland, including a comparison of service utilization and PCP budget utilization in LTSS Maryland compared to DDA's legacy system, PCIS2. The department concurs with this recommendation. Next, we have been asked to discuss the impact of vacant developmental disabilities program coordinator positions on timely review and approval of PCP budgets, the reasons for challenges in filling these roles, and efforts being taken to improve recruitment and retention for these vacancies. We would like to note that the vacant positions have had minimum impact on DDA's ability to review and approve participants' person-centered plans in a timely manner. Variables impacting timely review include waiting for documents, documents submitted without signatures, plans returned due to insufficient documentation to support the assessed need, delays in responding to clarifications requests, and these delays often extend beyond our service level agreements, and plans pending an appeal hearing. DDA has been successfully working through the process to obtain exceptions to the statewide hiring freeze for recruitment for program coordinators. Our current vacancy rate is driven by hurdles in the recruitment cycle, included extending posting and vetting timelines, compounded by a high rate of candidate drop-off and interview cancellations. Additionally, a high number of applicants do not meet our position qualifications or decline our offers due to salary concerns. We are actively investigating ways to leverage technology and feedback to streamline our processes and improve our ability to efficiently secure qualified candidates. While key recruitments remain underway, we have implemented a system to reallocate internal resources and team members when necessary to support other team members in meeting our 20 business day service level agreement approval timeline for person-centered plans. Next, DLS determined that the second quarterly report on community services spending to be in compliance with the language and therefore recommends that $500,000 in withheld general funds be released. The department thanks DLS for its review and for its recommendation to release the withheld funding. Next, to continue monitoring community spending, DLS recommends adding language restricting funds pending the submission of quarterly reports with spending data in LTSS Maryland for fiscal years 2026 and 2027. The department supports this recommendation as we do believe it is very important for legislators and the public to have visibility into our spending. DDA respectfully requests reconsideration of the deadlines associated with this requirement, however. To better enable us to produce accurate reports, we respectfully request that the deadlines listed on page 47 be extended by just 2 weeks, as the proposed deadlines fall during busy periods that will challenge our ability to produce accurate and timely reports. Next, DLS determined that the report on cost containment actions implemented in 2026 to be in compliance with the language and therefore recommends that the $500,000 in withheld general funds be released. Again, the department thanks DLS for its review and its recommendation to release the withheld funding. Next, DDA should provide the average wage and range of wages paid to direct support professionals in the traditional services model for services that would be impacted by the cost containment action in the self-directed services delivery model. We would like to clarify that any changes to reasonable and customary wages or the wage exception process in the self-directed model will not affect the rates or wages paid to direct support employees in the community provider managed model. The rates in the community provider managed model are often set by the CMS-endorsed BRIC methodology, which is also vetted by the DDA's Rate Review Advisory Group. Providers have the flexibility to set their direct support professional rates based on statutory minimum wage requirements or the minimum wage in their respective locality. Based on the most recent Maryland wage data from the 2024 National Core Indicators State of the Workforce Survey, which our providers are required to complete, the average hourly rate for direct support for professionals was $18.48, the median rate was $18 per hour, and the minimum was $15 per hour. We also learned that the maximum rate was $29.06. We have also included an appendix in our written testimony with that published in CI data with more information. Last, To monitor the implementation of fiscal year 2027 cost containment actions, DLS recommends adding language restricting funds pending the submission of a report with details on the implementation of cost containment actions, impacts to participants, and updated estimates for cost savings. The department respectfully acknowledges this recommendation. And that is the conclusion of the department's report. Thank you.
Thank you so much for your testimony. I see members are excited to ask some questions. Delegate Stanko.
Thank you, Madam Chair. And just to kick off, quick comment before a couple of questions. Thank you so much to the community for your activity and engagement over the last many weeks. I'm new to this subcommittee. I tried to count. I see at least 10 individuals in the crowd today that have met with me individually, both from the provider model side and the self-directed side. Additionally, for everyone's benefit, same to you, Deputy Secretary, and Mr. White, appreciate your time that you spent with me as well as Hannah Dyer from the governor's office, who I'm sure is around or watching somewhere and has been engaged. So I appreciate you helping me get up to speed. It's allowed me to being new, it's allowed me to take a very first principles approach to the questions that I've asked and learned through this process. And so I may have some questions that we've talked about directly and learned from you as well. And we talked about the ability to have everyone hear some of those. So just kind of kicking off and starting with the proposed cap to individual budgets. So for the proposed $500,000 cap on individual budgets, how would an exception process work to that? Can you just describe an example of a situation where someone would get an exception? And my understanding, again, learning, is that there are times that in the budget process, there's a big difference between, which is why I asked the question to DLS, a big difference between the budgets and the actual dollars spent. So appreciate if you could provide any context there, and also forgive me, thank you for joining us, Madam Secretary, as well.
So the budget exception, thank you so much for the question. The budget exception process will continue to keep the person center first and foremost in regard to services. The DDA has established a multidisciplinary team of licensed nurses, behavioral support specialists, our regional program directors, and so forth, to actually look at the services and supports that are being requested by each participant. So each participant, it will not be a blanket process. It will continue to be led by our person-centered planning process to make certain that the services and supports that the individuals need are in place for them. So we have taken a very deliberate, strategic, and careful approach at putting together this committee or group of individuals, multidisciplinary team, to implement the exceptions process.
Thank you. As a follow-up to that, why does there tend to be large gaps between budgeted dollars and dollars spent, or why does that happen often?
So during the person-centered planning process, there is an exchange between the participant, their family members, and their team in regard to the services and supports they want and need to support their goals and to achieve their goals. Often, individuals are not accessing or utilizing up to 100% of what has been planned in their person-centered budget, so therefore we have deltas.
Okay, thank you. And I think that my comment there is as budgets are being created, I think that's something that should be really tightly looked at in those conversations. So from a forecasting perspective, we're able to partner with the self-directed community to make sure that the dollars that they're requesting are the dollars spent, but also that that's a very important part of the projected forecast in any budget, and just think it's something that we can, without actual cuts, we can help get a better forecasted in the future. And I can do this one. Yes, thank you. Thank you, Madam Chair. So as a follow-up, or not a follow-up to that question, but kind of changing course, I want to talk about the impact of proposed cost containment to both the self-directed and the community provider model. Do the four policies, from your perspective, do the four policies proposed impact the self-directed or the community provider program disproportionately? And my definition of disproportionately would be per capita, right? So person by person. And if they do, why was that approach taken?
So the department looked very carefully at its spending trends. As we noted in our conversation, we have two very significant cost drivers. One is personal supports, which is under the self-directed services delivery model, and the other is dedicated hours under the community provider managed model. We looked at the billing behaviors. We looked at the services and supports that have been provided, how they're being accessed and so forth. And we feel confident that there is not a disproportionate application of these sustainability proposals to either service delivery model. Both service delivery models are very much needed for us to operate this program in a manner in which individuals are able to get the services and supports they need to live in the communities as they wish. We find both very valuable. So we did not, when we looked at our sustainability package, it was very carefully calculated, data-driven, and based on our cost drivers, which impact both service delivery models.
Okay, thank you for your input there, and I appreciate that. So my last kind of set of questions is with regards to, again, being new to the committee and learning, and in that learning process, particularly around the MidSec and the partnership with the MidSec. And so we talked about this when we met, and same with myself and Hannah. You know, one of the things that I'm a big believer, I think I said this explicitly, clarity's kindness, right? And so the ability to get very, that I'm even more of a like, wait longer to release information until you have certainty in that in that release, and that's something I've heard from all parts of the community, that there's been some challenges in that, and some press releases that went out and then information was pulled back or disputed, and so from my context there, just as we have a go forward on that, and you may disagree, but as we have a go forward on that, I would appreciate any release of information is really vetted to as much finality as that you can have in that finality, right? So holding back information until you're at a place where you feel like it's finalized. If you disagree with that, that's fair, but that's what I've heard from the community and thought it would be worth sharing here. And in the context of that, so from the MidSec, I know the decision was made collaboratively, right? So with community folks and with the administration to not get a formal proposal from the MidSec. What I would say with the cuts as a member of the subcommittee is hearing from the MidSec, and this is maybe for those in the crowd, with their proposed cuts would be very helpful for me to understand, you know, where they feel like the best places for cost containments are. So it's much more collaborative in a you know, shared discussion in that way. So I guess that's more of a comment than a question, but I guess would their input directly or publicly, would that be helpful to you all as well?
So may I address your first
Absolutely.
comment?
Yes.
So in regard to your first comment, I really appreciate that feedback in regard to making certain that data are vetted and accurate before being provided to the committee. The department, because the MidSec meetings are very conversational and it's exploratory in nature, as we are receiving data requests for exploration, we are working very closely with our academic vendor, the Hilltop Institute, in those data analyses, and also very honest with the MidSec members in what we can provide when we can provide it. As we continue to do additional drill downs, the data may change just based on the cut and so forth. So thank you for that feedback. We will make certain that we have vetted and accurate information to the best of our ability during those conversations. In regard to the second comment, having the MidSec actually provide recommendations and so forth, the department really appreciated the fact that the MidSec members came and talked with us because we want to be transparent. We want to understand from the community any impacts and so forth. And the department also understands the situation that those members are in, right, as advocates for their family members, loved ones, community partners, and so forth. And so the department made the decision to allow or to accept that the MidSec membership did not want to put forth recommendations or suggestions for consideration into the governor's budget, and we did that in a respectful way.
Okay, I appreciate you sharing that. They also didn't want to do that, so I appreciate you sharing that publicly today. Madam Chair, thank you for the latitude.
Thank you to our newest member of the subcommittee. Really appreciate how much time you've spent like really educating yourself and sitting down with members of the community and with the administration. So thank you for those of you who continue to advocate with us individually and here in our committee. I will turn to you now, Delegate Ruff, for a question. Oh. Okay, Delegate Heinbaugh.
That's twice you've done that for me. I appreciate that. Thank you. Thank you, Madam Chair. Well, thank you all for, it seems like I'm saying the same thing every time I talk to you, but thanks for the thorough response to the DLS analysis, and thanks again for the critical mission and the work you do and the services you provide. My question's a little narrower in scope, and it has to do with vacant positions. And on page 24, Exhibit 14, I'm interested, 7 of the vacancies, I think it said, have been vacant for over a year. 2 of those are in Western Maryland, and they're disability program coordinators, I believe, in the Western Maryland Regional Office. So I'm obviously interested in that. So what's the prognosis? When do you think those will be filled, and what kind of impact is it having on completing the mission in the Western Maryland Regional Office?
It's a great question. So in regard to the impact, we're making certain that we level load within that office to ensure that all person-centered plans, all provider applications, all of the daily operations are being addressed in a timely manner and within our service level agreements. These positions are very challenging to fill. They are providing support and services to case managers, as well as family members and representatives of individuals with intellectual and developmental disabilities. So it takes a particular skill set in order for these individuals to, the department to actually extend the offer. We're also finding, as I mentioned, and particularly in that area, the salaries are challenging. And so we're going to continue to do our best to work through our vacancies. And as we are, as one MDH, we are working very closely to make certain that each regional office has what it needs, as we work through our vacancy.
Oh, thank you. So you're saying that by shifting resources, the processing times aren't suffering in the Western region compared to other places?
Correct.
Okay. Thank you. Thank you very much.
Absolutely.
Thank you.
Thank you, Delegate. Delegate Ruff, and then Delegate McCaskill.
Thank you, Madam Chair. And thank you all, Madam Secretary, Madam Deputy Secretary, entire panel. I had a couple of questions. The first question I have relates to person-centered plans, and I know other folks will have different aspects of questions, but I just wanted to kind of get an understanding and allow you to have an explanation to everybody and, you know, the millions of viewers watching us live here. What steps are involved with submitting a person-centered plan, and what are the roles of different stakeholders in that process? What data can MDH share that identifies the barriers to timely submission of person-centered plans?
So I'll start. That's a loaded question. So first, what are the steps? So the steps with submitting a person-centered plan starts with the case manager working very closely with the participant or their authorized rep and their team to develop that person-centered plan. Once that person-centered plan is developed, it is then submitted to my office, one of my regional offices, depending on the region, by way of our electronic health record system known as LTSS Maryland. Once that is in the system, my office receives an alert to look at that plan. We have plan reviewers in each regional office, and there are auto assignments based on the algorithms within a system. My team has 20 business days to review and process a person-centered plan when all of the documentation is in and complete. In the event that the documentation is not in, my regional office works very closely with the case management entity, again, by way of LTSS Maryland, and also picking up the phone, going back to the basics, right, and talking with the case manager through any questions or requests for clarification. Also, that also involves the participants' team reaching out to my team members to talk through. So it's a very comprehensive process that is not unilateral, not done in a vacuum. We make certain that, you know, the participant and their team members are involved in that process. What was the second part of your
So the
question?
second part was about the data that you guys can share that identifies the barriers to submission timely of person-centered plans.
So we will be actually collecting that data. I can tell you that we have a service level agreement, again, 20 business days to process a complete person-centered plan. In regard to counting the number of days to get it in and so forth, we're going to develop some reports to provide that information for you all in a future report.
And do you have kind of an idea of when that will happen?
We will get back to you with that.
Okay.
We need to understand all that's entailed with creating those reports by way of our system.
Okay, and the last kind of category of questioning I have is around equity in who receives community services support. So obviously over some time now, advocates, researchers have rung the alarm on measurable inequities in who accesses community services support across racial, ethnic, language, geographic, socioeconomic status. Specifically, Black stakeholders, Latinx stakeholders face inequities in service types, access to self-directed services, and wait list durations. So additionally, I think there's some studies out there that show that individuals of color often receive lower public funding compared to folks in the majority culture. So can you give me an understanding of how DDA is tracking progress towards those, eliminating those disparities? What internal accountability systems are present inside the administration to ensure that we're meeting those goals? What are those goals, right? How they're being monitored, and ensuring that funding allocations reflect the makeup of our community.
Sure. So I can tell you, since the Moore-Miller administration, the DDA has taken a very intentional approach at looking at the equity and access issues that have been pre-existing and actually for far too long. Under our leadership, we have been making a concerted effort to get out to underserved and underrepresented communities. I've personally gone into Baltimore City, where there is gross underrepresentation there, visited providers, visited participants, as well as their family members, and as well as in Montgomery County, understanding that there are linguistic issues and so forth. In those conversations, I'm hearing directly from providers, participants, and their families about how DDA can do a better job at accessing or creating that access, which would build the equity into the system or assist with building the equity into the system. For the first time ever in state's history, the DDA actually hosted its first all Spanish-speaking engagement in November of 2025. That is as a result of my team and I getting out into the community to speak with participants, providers, families, and various advocates. Also, since the fall, we have been doing a bit of translation of languages, Spanish, I should say, for many of our documents, and we're on pace to continue in that thread, in that vein. We agree that equity and access is a challenge for the DDA, but we are committed to continuing our efforts to address those issues.
Okay, and I hear you, and I'm encouraged by that, but I think my question was more specific to kind of systems of accountability. So I hear the efforts, and I like the fact that you had this wonderful all Spanish speaking event. That's amazing. Can you give us a little bit more specifics on how system-wide there is, from the top down, a concerted effort and accountability system that will, number one, that has set a goal, kind of identified where we are, and then identifying where we want to be, how we get to ensure that the state of Maryland is providing equitable, community-based services for all citizens that are stakeholders of the developmental disabilities community. I think we would like to hear what specifically that goal is and how we're going to get there.
Sure. So as a part of our fiscal year 2026 strategic plan, we have identified specific goals there, and I'm happy to provide that data at a later time. I don't have it readily available with me today.
Okay.
If I may, I think what you are raising is something that has been a focus for us across the department. You know, we have on our website, right, when we talk about our vision for a healthcare system that promotes the best quality health and healthcare, we talk about our mission of protecting and advancing the health and well-being of all Marylanders. We also, on our front page of our website, talk about our mission to reduce health disparities, where we want everyone to have that fair and just opportunity to achieve their optimal health. And Deputy Secretary Hutchinson alluded to her strategic plan. Each of our administrations has a strategic plan where we are looking at operational excellence, how we are addressing health disparities, how we are promoting health across the lifespan, and how we are promoting community engagement. And so each of our administrations is looking at prioritizing their work along these goals. And, you know, as mentioned, each administration has metrics, so certainly this is something that is of focus across the entire administration. And also with our Office of Minority Health and Health Disparities, where we have recently brought in a new leader who has more than 20 years of experience looking at data, engaging with communities on issues of disparities.
Thank you guys so very much. I mean, it's I think very important that we acknowledge that you all recognize the problem,
Yes,
right?
absolutely.
And that is the number one thing. I think we could probably say in our previous administration that was probably not readily apparent. But the fact that you all acknowledge the problem and understand the sincere detriment that brings to people of color, and that it needs to be fixed in a way that is measured, but also very, very pointed, is something that I'm looking forward to seeing from the additional information that you provide, and that we are protecting all Marylanders in a fair and equitable way. So thank you so very much. Thank you, Madam
Absolutely.
Chair, and thank you for your indulgence, the rest of the subcommittee.
Of course, thank you so much, Delegate. Excellent questions. Delegate McCaskill.
Thank you, Madam Chair. I'm just going to go ahead and ask at the top that you allow me the indulgence of a few bites of the apple. Thank you so very much. Thank you all for being here. Thank you to our DDA community for being here as well. My questions are kind of scattered. I did have concerns about my colleague, Delegate Ruff, about the inequities within the system. So thank you all for answering that. As you can imagine, we have been flooded in our office, both in person and in our emails and phone calls by the wonderful advocates of the DDA community. And so there have been many concerns that I will say that have been replicated, but none of them are at the least. And my staff have tried to group things together. So for the sake of time, what I do want to do is send you all out some specific questions in reference to the eligibility of dedicated one-on-one supports based on the proposed budget changes, because there were quite a few after they grouped them together. So I do want to send them out to you all for some points of explanation. For community events, I just was making a note. When you all hear the concerns of the community, how is that response given back to the community? I know that we make policy within agency, right? But how does the community know what's happening? And how do you keep them connected to their concerns?
Sure. So last fall, we did, as you heard, well over 100 engagements. Part of those engagements, we went out in every region in person and spoke with the community. We heard that the community was tired of DDA talking to them, and so they wanted an opportunity for DDA to listen to them. So we went out and we had those listening sessions. After those listening sessions, we then published in writing what we heard and what we were doing to follow up. Immediately after that publication, we went out again in all 4 regions and hosted what we called collaborative conversations. And that was just an opportunity again for the community to have my team and I before them to talk about the concerns that they're having with DDA. We also have live trainings, we have the Waiver Advisory Council meetings, we have community engagement meetings, or what we call community meetings, and from that, those are posted online so that if individuals don't have an opportunity to participate in them, they're readily available. And I would also like to say that because we were sensitive to families who work and participants who are in their day services and so forth, we went out to those 4 regions in the evening from 6 to 8 p.m. to accommodate family and participant schedules. So as we're doing this, we are also following up in writing.
Thank you, I appreciate that. And is it opportunity, perhaps online, for folks with concerns to send a comment through your website?
So
or-
as we are having webinars, there's a live chat function.
Okay.
That is complicated for individuals, as we've heard, because they can't get as much feedback in during a 1-hour webinar or a 2-hour webinar. And then it's also difficult for the department to respond to all of those, all of the feedback and questions within the time allotted. So we take all of that feedback and we've developed a living document of FAQs that is also available on our website at any given time. We're also in the process, because a living document of FAQs of very technical questions and so forth is very complicated and it's pretty dense. So we are in the process of looking at some of those common themes, and we're going to record video vignettes, very short video vignettes, to be posted on our website for the community's access.
Nice, and
If I can add one thing, a lot of what Deputy Secretary Hutchinson is talking about, how they have tried to, do a better job of closing the loop, those are oftentimes ideas that the community gave to us of what they think could be helpful. And so we're like, we want your ideas on what can be helpful to improve the dialogue that we have around these really complicated issues.
nice, and will that also be in multilingual, perhaps? We'll take that into consideration.
Definitely.
Perfect. I want to move on to 2 last questions, I promise, Madam Chair. Has the DDA already started denying dedicated supports that have been approved in the past for our community?
The DDA continues to operate its program, so we do review each person's unique situation, and if the assessed need is not justified, we will issue a denial.
Perfect. And one for the record and for my brain, can you just give me the appeal process once again for issues for denials?
Oh, absolutely. So upon the decision on the plan, if it's a denial or if the participant is not satisfied, they have 10 days to file an appeal. Most often, they work with their case manager. Sometimes we receive the appeal directly. Participants can appeal in any manner in which they choose, in accordance with the Medicaid Fair Hearings process. Appealing within 10 days allows the participant to retain their benefits pending the outcome of the appeal. So they'll keep the benefits that are in place, the services that are in place, pending the outcome of the appeal.
You must have known my next question then. Okay. Lastly, I just want to speak on a fiscal note, since we are appropriations. Can you give me a breakdown of the cost per person for self-directed care, the average cost per year for self-directed care?
Just checking here to see if I have that.
No
so that
worries,
the record is-
we could do a follow-up.
Let me get back to you with that because I want
No
to
worries.
provide a fair and accurate number.
No worries. And then after we get that information, I'm just looking at it from a fiscal lens of self-directed care and traditional provider care and our fiscal responsibility as policymakers and as the agency look forward and as our DDA community look forward of how we can continue to be fiscally responsible, but also trying to meet the needs of our community. Thank you. Thank you, Madam Chair.
Thank you so much, Delegate. If it's okay, Madam Vice Chair, I'd like to recognize the chair of the full committee first. Thank you.
Thank you. I don't have a question. I do just have to, some other meetings I have to go to, but I want to let all the advocates here know that I will be watching the end of this hearing tonight. So I'll hear from each and every one of you. Thanks to our Secretary and Deputy Secretary for being here. To the community, you know sort of the priorities of this House. You saw it last year. We worked very hard in very difficult budget times to restore as much funding as we could. We're going to endeavor to do similar things this year, but we do also have an obligation to make sure that our Medicaid waiver is not put at risk, which would be catastrophic to our state and this community. And we want to hear from you. I know our great subcommittee chair, who we're so lucky to have, is going to be working this tirelessly until we move a budget with our friends in the Senate and Senator Gazzone. So we're here. My door is open. I will be watching every single advocate that is here tonight after I finish my meeting. So with that, I just wanted to say thanks for having me.
Thank you so much, Mr. Chair, for joining us. I really appreciate your time. Thank you. Recognizing Madam Vice Chair for questions.
Thank you so much, Chair. And first, I want to thank the commitment of our leadership here. Madam Speaker, Chairman Barnes, who sat with us all last year as well in the hearing, and Mr. Speaker Pro Tem, thank you so much for being here. I also want to thank Secretary and Deputy Secretary for our, not just today, but also for our earlier meetings. Our shared passion for Marylanders who need us most is evident in the conversations that we've had and that we will continue to have in these very difficult conversations. I also need to take a second to thank the scores of folks who have come to my office, who've emailed and shared your stories with me. Constituents in Growl's supermarket with my family at the Baseball Diamond, friends for over 25 years. I have a lot of questions. So I'm going to need the whole apple and maybe a few extras.
You may have them all.
Thank you. So let's start off with dedicated hours. Does the administration's proposal on utilizing shared hours before turning to dedicated hours impact medical or behavioral needs? For example, if two individuals are roommates and one has dedicated support aid for medical or behavioral needs, would that individual be prohibited from utilizing those hours before exhausting shared hours? Would participants be required to use only their own 20.5 flex hours first, or would they be required to also use any unused flex hours from their housemates before using dedicated hours?
The answer is, if someone has an assessed need for dedicated hours, they will be able to access those dedicated hours without needing to exhaust the shared hours for the home. So they would have immediate access to the dedicated hours.
Okay, so that's, okay, thank you. I want to, some of my questions somewhat dovetail into some of my other colleagues' questions, and I just want to make sure to get my specific questions on the record, please. So I want to go over to personal centered plans, PCP plan timelines on page 10. The DLS report, we see that the percentage of both timely PCP review and approval by DDA has increased and remained high over the years. However, PCP submission by CCS has remained low. Only 62% of PCPs were submitted in a timely manner in FY 2025. We look forward to reading the report DLS has requested to better understand the nuances of this issue. Do you have any comment on any of that? I just want to give the opportunity.
Sure. So the DDA has been meeting very frequently, monthly, and sometimes biweekly technical assistance with its case management agencies. We are looking at the challenges in regard to PCP submissions from a holistic approach, from the point at which we can better help participants and families get the documentation in that's needed, to the point at which my team or the DDA itself is actually providing the kind of oversight that's needed of its case management agencies, and also to the point at which my team is also operating within its service level agreements. We will be putting together the report as DLS is requesting, and we'll have additional information for you at that time.
I would appreciate that. Thank you so much. Let's move on to staffing challenges. Page 23, DLS notes a turnover rate of 13%, a level high enough to impact operations. I appreciate that DDA is doing what they can to streamline systems and relocate resources until some or all of the 28 vacant positions can be filled, and I'm comforted by DDA's assertion that vacancies are not impacted by PCP approval rate in any meaningful way. In your testimony, you cite many understandable challenges to hiring, such as high bar for qualifications coupled with low salaries. You mentioned that earlier. You also cite extended posting and vetting timelines. Is there anything you can elaborate on right now for this question, can do to, in reducing those specific timelines?
So in regard to, just for additional context in regard to the posting and vetting,
Yeah.
We have a 2-week posting, right? So individuals have an opportunity, and we post by way of LinkedIn, the newspaper, you name it, to get qualified candidates. That process, again, the posting is for 2 weeks, and then we give the individuals an opportunity to apply. Often we are challenged with having to repost because either we're not getting any interest in the position itself, or if we do get interested candidates, they are not qualified. So that then rehashes the whole process all over again to, in regard to recruitment efforts.
So has there been any consideration of having someone whose job it is to help guide individuals and families through the redetermination process? There used to be someone in that role, and I was wondering if this is connected to the staffing issues.
So in regard to the redetermination process, the participant and family, they have a team. The team is coordinated by the case manager, so the case manager is front and center there. There is also an individual at each of my regional offices available for questions in regard to redetermination. As this is a concurrent enrollment process, we work very closely with our Medicaid partners within the Maryland Department of Health to assist families and participants with the redetermination process.
I'd like to move on to response time. You touched upon something similar, appeal of denials. I've heard from a number of Marylanders regarding the response time and the ability to appeal a denial. And help me just in case, but it's my understanding that there is a 20-day response required for request for an individual and family-directed goods and services benefit, the FMCS. Is that right?
Correct.
So, so the email will go out, and the initial email will have the decision only. So if it's denied, the reason for the denial, and therefore the ability for the client or the families to properly file an appeal of denial, it must wait for the full letter representing the DDA's denial of IFDGS request. It sounded like through sitting with constituents. I have a redacted version right here. For example, I think a lot of the concerns from families were similar to the one that I'm holding, which it says here on 5/2/25, financial management and counseling services received your request, right? They received the letter in February, that was in 2025. They received the letter February 11th, 2026. That's 8 months later. It would have, if it's a 20-day drop, in order to reach out, in order to say, let me explain and appeal this denial, in the 8 months it took to get the letter, the family has had to go and get, let's say, the medical device, the retainer. That's a long wait. So is this due to staffing shortages as well?
I would need to look, first and foremost, an 8-month wait is unacceptable.
Yeah.
I do need to look into the situation because I am not familiar with that situation, and that is not anything that typically happens. So I would need to understand the unique circumstances around that. But 8 months for any decision is unacceptable.
I'm so glad that you agree with me, and all of us. And I know that what you all have walked into in really trying to be there and clean up quite a bit has been Herculean, and I appreciate that. But this is, I look forward to an offline conversation where I can share this, and I want to highlight that so many of my conversations have returned to, I feel like I don't have anyone to talk to, I don't know where I can call, no one's answering the phone. So I thank you for letting me share that. And in just closing, there have been several conversations that I've been able to have with constituents that have continued to ring in my ears as I prepared for today. And one that kept coming up, I feel from my heart, I apologize, thank you, was the fight that every parent feels that they begin at birth and they continue. Every part of my child's life is a fight, finding out what's wrong, seeing specialist after specialist, genetic doctors, every doctor out there, fighting insurance, fighting school systems, fighting doctors, while trying not to get fired from my job, fighting for my marriage, fighting to go outside, fighting just so my other children can go and participate in their lives and have some other parents be on the sidelines for them. That was so heavy on my heart, and because it was echoed not in coordination by all of the folks who I met with. So I really thank you for allowing me to share that. Thank you so much.
Thank you. Thank you, friends. Thank you. Thank you for sharing that story, Madam Vice Chair, on behalf of your constituents, and for your advocacy, your strong advocacy. I don't have too many additional questions I want to ask. I do want to ask, though, a question, please, to the department around reasonable and customary wages and the BLS rates. So the administration has proposed to align wages for personal support staff with BLS ranges, in part to address some of the initial cost driver challenges that you have that you identified earlier in your testimony. So can you share with us, what does that mean at the top of the pay scale? So for example, if a direct support professional is currently making $32 an hour to care for an individual, how would the changed policy impact their hourly pay?
Yeah, so the proposed reasonable and customary, the new proposed reasonable and customary rate table is based on the Maryland Metropolitan Statistical Area BLS for 2024. We took that rate table and we trended it forward by 2.4%. That is the Consumer Price Index increase for urban consumers. So that would currently put the proposed wage, top-of-scale wage for personal supports at approximately $23.69 an hour.
Okay, so an individual who is currently paying their aide $32 an hour would have to drop them to 23, you said?
That's correct.
Okay, and without the wage exception in place as proposed by the administration, if there is an individual who is providing care for somebody who is participating in the program, who has extraordinarily medical needs, and perhaps this individual has been with them for a long time, and they are, they're very familiar with them and their needs, what avenue do they have, if any, to provide support for that aid? I was under the assumption, based on early conversations I had with the administration, that this would take it from the top of the pay scale of 37 to 35 an hour, and an individual making 32 an hour would not be impacted. But it sounds like, based on the data that you're sharing here, it's actually lower.
That's correct, and that's the top of scale, and the proposed BLS wage is contingent on the actual occupation code, and that is the same methodology that we use to set the provider rates in the traditional, in the community provider managed model.
In the community provider managed model, are those individuals also receiving benefits, though, through their employer?
Perhaps.
Perhaps. but
Yes,
if-
there is a component.
Okay,
There is a component for employee-related expenses, and I would add that the reasonable and customary rate table is different from how the budgets are built in the self-directed services model, so there would also be the employee-related expenses component in there. So, and we do currently have individuals who are self-directing the services that do offer benefits, but
Okay.
it is up to them as the employer.
so as an employer who's participating in self-directed, they do have the option of providing benefits for their staff, because I think what we've heard from advocates in the past is that one of the key ways that they recruit staff is through pay, because they are unable to offer benefits. But you're saying that DDA's interpretation is that the self-directed program would allow, in an individual's budget, for the option to provide, potentially benefits that could compete with an individual who otherwise might work in like a traditional program as a
That's
DSP.
correct. And it is allowed currently today.
It's allowed currently?
Yes.
Okay. Okay. All right. And so this is more helpful than I realized it would be. Thank you. So let me ask another question related to the community services waiting list, please. On page 9 of the DLS analysis, we see that the community service waiting list has steadily decreased over the years. Most recent year reported as FY25. Do you anticipate that the size of the wait list will continue to decrease in '26?
I'm sorry, would you mind repeating your question, please?
Yeah, sorry, let me pull the page up as well so I can follow along with my own question. Page 9 of the analysis. See that the point in time community services waitlist count has been decreasing steadily over the years. And my question is whether you are anticipating a continued decrease in this wait list, or will it hold steady or increase based upon the budget that you've recommended?
It is our goal to continue to decrease it. Unfortunately, what's happening is as individuals are awaiting an opportunity to apply, because they've been on the wait list so long, they are then, their situation is deteriorating, and so they're moving into crisis resolution, which is when we are actually able to provide the opportunity to apply much sooner than those who are in the other categories.
Oh, understood. So when somebody moves, so say from crisis prevention into crisis resolution, then they're able to get, potentially see some shifts in the wait list as a result? Okay.
Correct.
Okay. Thank you. Any further questions from members? Okay. Thank you, DDA and MDH team, for joining us today. We know that we are continuing to have many, many conversations about this particular budget, as all of them. We do have 37 witnesses signed up today. All of them will be heard, as is the tradition and custom of our subcommittee. And as I mentioned in the beginning of our hearing, we will ask and invite our MDH and DDA friends to please stay, hear from everybody, and if warranted, we might ask you to come back and just answer any remaining questions that advocates have raised, please. Thank you. All right, so to begin, so there's actually, one moment, please. Sorry, apologies. Thank you. See, everyone needs a Joe. So there was, excuse me, a slight movement in this list. So let me start by calling Tracy and Connor Farron, please, to the table, please. Tim Weens, Rachel London, and then that's 4. So we'll do those 4 for now, please, and then we'll go to the next panel. Thank you. As a reminder, every panelist will have 2 minutes. However, if required, we'll be happy to extend. Thank you.
When the day get to when Christopher Rock and one.
You want me to start? Okay. Good afternoon, Madam Chair, Vice Chair, and members of the committee. I'm Tracy Farron, special ed advocate professionally, but I come before you today as Connor's mom. Connor self-directs his services under the Developmental Disabilities Administration. I have years of lived experience, not as a provider, an administrator, but as a parent responsible every day for his health, safety, staffing, and quality of life. By DDA's own numbers, self-direction is a cost-effective model. With the help of his team, Connor can recruit, train, and retain quality staff who can support his complex needs. When rates are cut or wages are reduced, we lose qualified staff. When we lose staff, we lose stability. And when stability is lost, behaviors increase, medical crises become more likely, and the costs rise to the state, not fall. With proposed budget and wage cuts, individuals will be harmed. Some may face life-threatening situations due to lack of adequate staffing and support. These are not abstract numbers. These are human lives. I'd like to share a very powerful positive of self-direction with you today. After years of intensive training and practice, Connor gained his voice through AAC, which is Augmentative and Alternative Communication, at age 30. One letter at a time, one word at a time. Through self-direction, we were able to ensure consistent, trained support staff who believed in his competence and helped him build this skill. Today, he can tell us his wants, his needs, but most importantly, who he feels safe with. To me, this is the true meaning of self-direction: dignity, autonomy, accountability, and safety. For Connor, this is his voice guiding his life. We cannot go backwards. A budget reflects our values. Maryland must choose to protect its most vulnerable citizens. Our families matter. This community matters. And Connor's voice, hard-earned, letter by letter, deserves to be heard. Thank you.
Thank you so much. Connor, we welcome you to share with us your story too.
So this is our first time doing this in an environment like this. So in the true spirit of autonomy, I'm going to ask Connor if he's ready. If not, I will read his statement. Would you like to say anything? Y, E, S. Yes. Okay. Would you like to tell the committee why self-direction is important to you and what it means to you?
This is important.
This is important. Good job. I, get right to it. A, M, H, E, and after E, A, R, D. Okay, I am heard. R. Okay, I didn't follow you. I am heard. It's okay. Get right to it. T, O, D, and after D, get your letter. T.
R. Yes.
I hear you. All right, you said I am heard. F, and after F, O, and after O, R, and after R, T, and after T, after T. Get your letter. We have T. I'm not following you. I'm heard for T, H, and after H, E, and after E. Get right to it. L, E, T, S, O, M, E. That's, okay. Is there anything else you wanted to say?
Yes.
I. He said to say I love you. All right, is there anything else? All right, You want to say anything about your supports? M, Y, S, U, you got this. P, and after P, P, O, R, T, after T. Okay, my supports. M, O, R, E, I, M, after M, P, O, R. Okay, I hear you. T, and after T. What's after T? A. We have T, A. N, T, L, Y. My supports, more importantly. Which one? L, O. Okay, which one? L, O, V, E. L, I. Okay, want to back up?
Yes.
Okay. Are you going to finish up? K, A, Y, K, A, Y, L, and after L, it's okay, A, Kayla, I, S, T, let's back up, T, and then T, M, all right, back up, T, H, E, Kayla is the M, O, R, E, Q, U, A, L, I, and then after I, F, I, E, and then, all right, let's back up. What's after E? Okay, I'm not following. After E. E, and then D. Okay, Kayla is the more qualified. R. Okay, do you need to back up? Okay. U. N. Next, we have U, N, D, E, R, under, H, E, R, H, I, I'm losing you, under her, H, E, her, okay, her what? T, L, O, okay, I lost you.
Lost you.
All right, do you want to say anything else? H, E, R, T, right, comma, finish, or you want me to finish?
Finish.
All right, finish it up. H, E, L, P, help, R, I, all right. All right. Okay. All right, buddy. Let's finish, okay? I, W, O, after O, U, L, W, O, U, L, D, T, H, A, N, it's after N, K, thank, P, R, would like to thank, get right to it, T, L, D, and after D, T, O, D, A, and after A, T, O, D, A, get right to it, Pond. Let's finish it. T, O, D, A, Y. I'd like to thank today, F, O, R, T, after T, H, and after H, I, and after I, S, and after S, get right to it, O, and after O, P, and after P, P, and after P, O, P, P, O, you got it, after O, O, P, P, O, R, T, and after T, U, and after U, N, and after N, I, and after I, get right to it, after I, T, and then, after T, I, T, which one? I, T, all right, Y, period. He'd like to thank you for this opportunity today. Thank you very, very much.
Connor, that was really well done. That was really well done. You did a beautiful job. We really want to thank you for sharing your voice with us and being super brave in doing it. And thank Mom for all your help in helping. Really appreciate it. Thank you. Okay, we'll go to the next. Either one of you.
Sure. Madam Chair, Madam Vice Chair, my name is Rachel London. I'm the Executive Director of the Maryland Developmental Disabilities Council. We are a public policy organization that creates change to make it possible for people with developmental disabilities to live the lives they want with the support they need. That includes people who receive services from DDA, the people waiting for services from DDA, and the people that don't even know about DDA or that DDA doesn't even know about. I'm going to focus on those people today, actually. But I do need to say first that home and community-based services provided by DDA's waiver are very different than healthcare. They are more than keeping people safe and healthy. It's about living independently as possible, like you are seeing, and we'll see more of today. And it starts early. When you think about my council member, Angie, a mom of a teenager with autism and other developmental disabilities, you actually have her written testimony where she describes why funding for transitioning youth is so important for her son and her family, helping him get and keep more independence, and his parents keep their jobs because he will have the supports he needs after school. We agree it's critical for all youth leaving the school system, and it does appear there's funding for transitioning youth in the budget. I also want to acknowledge that we've been meeting with the administration and really do appreciate those ongoing conversations. We remain deeply concerned about some of the discrepancies in the estimates, though, both in funding and in the impact on people's lives. For example, the analysis says there's $74.9 million for new enrollment of about 994 people. We understand 800 of those are transitioning youth leaving school. Great. The analysis also says that DDA estimates about 162 people who are transitioning from state-only services, which we know we want them on the waiver, will be moving within this budget. That leaves about funding for about 32 people. With all the other required reserve capacity, including for youth aging out of foster care and people leaving hospitals, the numbers are not adequate and appear to not really touch the over 3,400 people waiting for services on the wait list, or leave room for potential emergencies, like when a parent and a primary caregiver dies or can no longer support their loved one. There's a lot to figure out. We all know that. We appreciate your leadership on that too. We have to figure it out for all Marylanders with developmental disabilities in a way that hurts no one and makes sure people thrive, not just survive, and gets people off of a waiting list into a robust system that works for all those people.
Madam Chair, members of the committee, my name is Tim Weens. I am the Executive Director of Maryland Inclusive Housing, MIH. We were formed about 6 years ago to help DDA move services from a group home model toward a supported living model. Individuals with intellectual and developmental disabilities who choose not to live in a group home and can no longer live with their families need to find affordable housing, and that's the task that we were given. We are funded in 3 ways to do the services that we provide. We have a $260,000 grant from DDA. We have a grant from Medicaid, Money Follows the Person, and then we bill for housing support services under the DDA Medicaid waiver. We are funded at the same levels in the proposed budget as in the current budget, and I'm here to ask you to support those appropriations. The details of how we do our work and the numbers are provided to you in my written testimony. Part of our work is also advocacy, making sure that there is enough housing for people with developmental disabilities in Maryland. We are requesting continued funding of the DDA Rental Assistance Program, which is helping people move into their own housing. We would urge additional funding for that for the next year. We're also working with the Maryland Department of Housing and Community Development to make the low-income housing tax credits more accessible for people with developmental disabilities. Thank you for your time.
Thank you so much, panel. Do any subcommittee members have questions? Thank you. Thank you for testifying. Thank you for sharing your story. We really appreciate it. I want to recognize the speaker pro tem.
Thank you, Madam Chair, and thanks members of the subcommittee. For the time that I've been in the legislature, this has actually been the first budget hearing I've been able to be part of, and it's been an incredible experience, and it's been an incredible experience further speaking with people in my district, the district that includes south and southeast Baltimore City, talking to people really for the first time about DDA and about the challenges that they face and the challenges that they would face with some of the financial challenges that are being faced by the state. So it's been really an important day for me to be here. I unfortunately have to go back to my regular committee right now, but I want to thank you all for taking the time for being here today, and thank you very, very much for the stories you're going to tell, and I'll make a point of listening to the rest of today's hearing later this evening. So thank you very much.
Thank you, Mr. Speaker Pro Tem, for joining It's a little bit of a full circle moment. For those of you who don't know, I started my career here in Annapolis on his committee when he was chair of Judiciary. So we both sort of were like, what is the Appropriations Committee up to? They're doing so I really appreciate getting to spend the afternoon with you. Thank you for prioritizing being here today for a bit. We really appreciate your time. Thank you. All right, we will now call our next panel to join us. I'm going to ask Lisa Wiederlight to join us, Chris Leacock, Ariel La, and Laura Howell. That's 4. Let's see if we see 4 moving. Let's see, 1, 2, 3. Okay, Chris, let's see.
Madam Chair, Chris Leacock is not here today.
Oh, thank you, that's so helpful, I was wondering. Thank you so much, Ms. Howell. Then I will ask Elizabeth Eisner to join us at the table, please, if you're here. Okay, I see some movement, so that's good. Why don't we start at this end, if you don't mind? Go ahead.
Thank you. If I may, I know that the delegate asked a
I
question about...
apologize. There you go. Now your mic is on. Thank you.
Oh, sorry. If I may, I'd like to answer your question earlier to one of the DDA staff about why people who have larger budgets don't spend them.
You may include that as part of your testimony, but we will start the timer when you begin. So if you don't mind, start by identifying yourself.
Absolutely.
And then you can do
Yes.
whatever you want with your 2 minutes.
I'll do that at the end.
Thank you.
Sure. My name is Lisa Wiederlight. I live in Anne Arundel County and with my multiply disabled 25-year-old son. I hold a Master of Public Policy degree from the University of Maryland and learned that budgets are not only books filled with numbers, but also reflect our state's priorities. What the Moore administration's proposed budget is saying to us, that the most vulnerable Marylanders are not their priorities. I've also worked for the White House Office of National Drug Control Policy and in the U.S. Office of the United States Center. What I learned is, again, you can't play program sustainability against what must be the impenetrable wall of safety, community integration, and independence for vulnerable people. Many Marylanders who use DDA waivers cannot speak for themselves, need medicine throughout the day, and have behavioral health issues. Therefore, they need high-caliber, trustworthy, and well-trained caregivers who are paid what they are worth, or at least as close as we can come to it. When Maryland experienced a teacher shortage, we found the money to incentivize student teachers and maintain competitive salaries. Why not do the same for direct support professionals? Current economic conditions require something similar, yet with the proposed salary decreases, Amazon drivers would get paid more than our DSPs. For over 2 years, I voluntarily served as a member of the Maryland Autism Stakeholder Group on Autism-Related Needs, known as the ASGARN, and to my knowledge, we were never asked what we thought about these issues. About a month ago, I resigned from the ASGARN to accept an appointment as a public member of the Federal Interagency Autism Coordinating Committee. I'll probably be asked my thoughts about the contentious Medicaid funding cuts in Maryland, as this issue has been all over the region's media, and I'm really wondering what to say. I love Maryland. I've lived here for 39 years, but I believe these cuts to be unjustified and dangerous budget proposals that would directly affect my own son and other Marylanders who need their funding to keep them safe, independent, and included in the community. Someone in the state government asked me, what do you propose we do instead? And I thought to myself, how about reconsidering the large administrative costs being provided to the fiduciaries who administer our funding on behalf of the state? How about controlling overtime? My DSP and I need to justify even 1 hour of overtime to care for my son with no guarantee of payment for him. I understand that budgets and budget seasons are hard, but there has to be another way than jeopardizing the health and safety of our most vulnerable and their caregivers. Again, budget decisions are hard, but they should not affect funds that directly protect and preserve the safety, independence, and lives of vulnerable and deserving Marylanders and those who love them. I respectfully request that you send this budget back where it came from and demand that the Moore administration does better for everyone and work harder to govern more collaboratively, fairly, and compassionately. Thank you.
Friends in the audience, I know we all are so grateful for every single one of you to be here, but if we applause after every single testimony, we'll be here all night together. So let's go ahead and allow everyone to speak. So thank you so much.
Is this on?
No, once they're read, you don't have to mess with them like I do, so you're good.
Thank you, Chair, Vice Chair, and Subcommittee members. My name is Ariel La. I'm a speech-language pathologist in Rockville, Maryland, and I'm here on behalf of 21 organizations that serve We're Maryland disability organizations that are part of the Maryland Equity Coalition for People with Disabilities. And we recommend that you amend the DDA budget by addressing major equity concerns prior to passing the fiscal year 2027 budget. The Maryland Equity Coalition for People with Disabilities works statewide to ensure that every Marylander with intellectual and developmental disabilities has equitable access to services and support. Our coalition has documented persistent disparities in access to DDA services among immigrant families, people who are limited English proficiency, BIPOC communities, and others who face cultural, linguistic, and technological barriers when seeking help. These barriers are not theoretical. They show up every day in the lives of people trying to access critical supports for themselves or for family members. We want to share the story of one Maryland family that reflects what we see across the state. Liliana Baez, legal guardian to her brother Juan Carlos, a man with significant disabilities, told us that she felt lost trying to navigate Social Security benefits, medical insurance, lists, funding, guardianship, and the DDA application process. It was only when she connected with a cultural navigator that she finally received step-by-step guidance in her family's language and cultural context. The Equity Coalition has defined cultural navigators as a person that's more than an interpreter. We have 5 roles, and it's in our written testimony: systems navigator, cultural translator, advocate, community educator, and trust builder. So she shared that for the first time after receiving cultural navigator funding, her elderly mother felt seen, heard, and supported as they worked to secure critical services for Juan Carlos. This is not an isolated case. It reflects patterns we have thoroughly documented across communities. Last year, $150,000 of DDA ARPA grant was granted to our coalition over a 4-month period, and it demonstrated exactly what culturally responsive navigation can achieve. 208 individuals received one-on-one assistance, which is double our intended target. 164 outreach and education events were held statewide, which is 4 times the intended target. 100% of immigrant and limited English proficiency families reported increased access and satisfaction with support, and 98% of participants reported greater confidence in navigating the DD system. This small investment generated an outsized, measurable impact, but these gains were powered by a one-time fund. Without sustained support, the disparities we have documented and that are reflected in statewide data will persist and deepen. Acknowledging the current budget crisis, our organizations recommend the General Assembly establish a statewide request for proposals, specifically to fund cultural navigator programs for people with intellectual and developmental disabilities, building on demonstrated success of the ARPA-funded pilot.
Sorry, but your time has expired. Do you want to just finish your thought, please?
Sure.
Thank you.
It's in the written testimony, and
Perfect.
Yeah.
But no, go ahead. Finish the thought. Anything else you want to share with us? Highlight?
Just, we do want agency-wide accountability measures, just like Delegate Ruff had spoken about earlier in McCaskill as well. Data tracking, equity benchmarks, and public reporting.
Thank you. Thank you for your testimony. Ms. Howell.
Good afternoon, Madam Chair, members of the committee. I'm Laura Howell, the proud CEO of the Maryland Association of Community Services, representing over 125 developmental disability providers across Maryland. We understand the fiscal pressures facing the state, and no one is more upset than we are to be back here. But all of the high-level discussion has been about how the DDA budget is unsustainable. What we need to also talk about is that these cuts are unsustainable for people with disabilities and their families. The cuts will absolutely hurt people. In the community provider model, they will especially hurt people with significant disabilities and intense needs. It's important to note that higher budgets in provider services reflect things like higher risk, health risk screening tool scores that we understand to be higher in people who use provider supports in general. 2 of the 3 proposed cuts land almost completely on people who use provider supports, those for the dedicated hour reduction and the $500,000 budget cap. These cuts do not reduce complexity, they merely reduce needed services. I can't stress enough that this level of funding is not easy to come by. And Vice Chair Jones and Delegate McCaskill, to your question about dedicated hours, it's important to note that people are losing needed dedicated hours this year, despite your directive in last year's budget. This includes people being asked to use shared hours before getting dedicated hours, and dedicated hours being removed in the past year with no change in the person's assessed need. They just can't get it approved all of a sudden in their plan. There's so much we could say, but most importantly, please don't believe a narrative that tells you that these cuts are manageable and won't hurt people and are merely implementing existing policy. We respectfully urge you to reject these proposals, to work on long-term solutions. You know that we are here at the table to be part of the discussion, and we really want to thank this committee for your extraordinary support over the many years.
Okay. Good afternoon, Chair Shetty and members of the committee. My name is Liz Eisner, and I'm the mother of a wonderful 25-year-old daughter named Ingrid. I'm going to just put Ingrid's picture here so you get a sense of what she looks like. Ingrid has profound autism and intellectual disability, and she has a shunt in her brain to manage her hydrocephalus. Once Ingrid became a teenager, her behavior became very difficult. And as she got older, we had a great deal of trouble managing her diet, exercise, and behavior. She could be aggressive and violent toward herself, others, and property. It got to the point where I couldn't even take Ingrid for a walk by myself because it wasn't safe. Fortunately, everything started to change when Ingrid moved into her school's residential program for her last 6 months of high school and then transitioned to an adult residential program and meaningful day services with a community provider. Today, Ingrid is healthier and happier. She has lost 60 pounds. She has a structured, organized schedule that keeps her engaged and regulated, and she receives one-on-one support of a trained direct support professional during most of her waking hours. As a result, Ingrid's aggressive behavior has decreased significantly. Each person who works with Ingrid also knows how to help avoid physical activities that would damage her shunt in her brain, and also knows the symptoms of shunt malfunction. This is essential because Ingrid is nonverbal. Now I can even pick Ingrid up from her group home by myself and take her to lunch or for a walk. She's learning independent living skills. She does her laundry. She helps clean her apartment. And she used to be terrified of stairs, but now she can go up and down stairs in her home and in the community. If DDA funding is reduced and if Ingrid loses her one-on-one support, all of her progress will be at risk. Without structured supports from a community provider, Ingrid would become very disorganized and dysregulated. She would regress in her skills, and her safety would be in danger. I'm asking you, please protect DDA funding for everyone, including for those of us who rely on the community providers for critical support. Please protect the health, safety, and dignity of people like my daughter. Thank you.
Thank you so much. Thank you for your testimony. Madam Vice Chair for question, then Delegate Stonka. And Ruff.
Thank you so much, Madam Chair. I have Ms. Howell, it's good to see you. It's good to see all of you. Thank you so much for your testimony, everyone. Ms. Howell, we have had many conversations. I thank you for all of them and the work that you do. In your testimony, you covered several things as you were fitting in your 2 minutes, and I'm curious, you spoke twice of the 500,000 cap. Are there any other effects on people beyond limiting budgets?
Thank you for that question and for all of your support, Delegate Jones. So one thing that hasn't been touched on really in any of the discussions, so our understanding is that there are about 1,600 people with budgets over 500,000 and about 824 with their expenditures over 824. And I think most people think of it as, well, it's the people whose expenditures are over 500,000 that are going to be affected. But there is a significant impact on the other 800 people because there is a really important federal requirement called the community settings rule. And it was a major change in how we had to provide community supports. And we have to provide very individualized, very flexible services. And right now, the DDA waiver doesn't allow for that flexibility. It was redesigned, and the way that the Developmental Disabilities Administration, under the previous administration, addressed it was to say that budgets could have more hours than could be used so that people could have the flexibility that they need. So for example, if I get supports and I work in retail, and 1 week I get 20 hours and another week I get 30 hours, but I need 40 hours of support, I have to have that flexibility from week to week to maybe I'm 20 hours with a job coach and 20 hours in a day head program or community outings. And so when you cap those budgets at $500,000, we are going to lose a lot of flexibility for folks with more intensive needs, and that's going to be a significant issue as well. And a significant issue related to Maryland meeting the community settings rule, which is also a requirement in addition to cost neutrality.
Thank you so much. Thank you, Madam Chair.
Thank you, Madam Vice Chair. Delegate Stonko.
Thanks, Madam Chair. I want to, I'm learning still, but let you finish your thoughts from the beginning.
Thank you.
Or if you don't mind.
No, thank you. I mean, I'm sorry, this is only my third time ever doing this, and this is really big.
I'm supposed to ask questions. That's why I say if you don't mind.
Thank you. It's like a movie theater. So the answer to your question, and as I offered, my son participates in the self-directed waiver because of his medical conditions and his autism severity and behavioral issues. He has a rather large budget, and I'm thankful for that. The problem is because we have a direct support professional shortage, and we can't pay people that much money, and we need very qualified people to work with my son. He has a history of self-injurious behavior, and it can't just be anyone we can pay minimum wage off the street. So it's very hard to find people.
Okay.
So, as was said by the DDA correctly, a lot of the expenses pertain to personal supports. We can't find people to pay to do those very necessary personal supports. And so what happens is, I do the personal supports, and as family, as staff, I can only get paid 40 hours. So I work 40 hours with my son, and then I work for free for my son because we cannot find a direct support professional who's qualified to work with him and has the skills for the amount that currently we can pay for him. So when we can only pay less, it's only going to be harder for the individuals and their families.
Okay, thank you. One follow-up to that, just as a comment on in the context of pay, and I know that Chair had questions on pay and wanted to defer to her. The fringe or healthcare benefits, can you give me your thoughts on if you agree with the framework that was laid out by the administration?
I can't keep track of it, very honestly. I have a degree in public policy. I can't even understand it. Thankfully, the one DSP who we have, who is fantastic and the best we've ever had, thankfully, his name is Isaac, and he's right up there, and he's transformed our lives. I think he doesn't need benefits, but what I can tell you is it certainly would help if we had the best benefits, if we can provide top-level salaries to people who need them and protect our children's lives every single day. We need to give them the best. And I know it's expensive, but what's more worth it than protecting people's lives who are vulnerable and need it?
Thanks for the time.
Yes.
Thank you so much. Thank you, Delegate Stonko, for the questions. Delegate Ruff.
Thank you, Madam Chair. Ms. Howe, I know you were talking about the reduction in approval of dedicated hours. Can you give us MACS's kind of more specific position on the consequences that you all see from that provision?
Thank you, Delegate, for that question. I mean, we're very concerned. We have community providers in every district, every jurisdiction in Maryland, and they are routinely telling us that they are seeing scaling back, changes in the existing policy. This is probably an area where we respectfully agree to disagree. You know, the administration has told us that they haven't changed the policy, but what we see is people having to show the use of shared hours before accessing dedicated hours, having to show house schedules, staffing schedules, which is what's been proposed and was proposed last year. And you all said, no, we don't want you to do that. But that is what's happening this year. It's not happening to every single person, but it is happening consistently enough across the state that it is a significant concern. We also see in a more nuanced way, as I said earlier, people who, I'll give you an example, have pica, which means they eat things and ingest things that aren't necessarily food. That can be incredibly dangerous. And the most recent example was someone with pica who had dedicated hours, had one-to-one staffing, which they absolutely needed to stay safe. And now this year they're being told you don't need it anymore, even though nothing had changed in the assessed need.
Awesome. Now, and in follow-up, does MACS have any position on the existing cost containment, I guess, method of accounting for the cost projections for this fiscal year coming up?
So As Ms. London said, we're very grateful for the ongoing discussions with the administration. There's no question about that. We are concerned about what has been kind of a shifting, evolving, and I don't mean over 6 months, I mean over the last month, different projections that we've gotten around what impact these different proposals would have, how they would be implemented. So we are really concerned about whether the cost containment measures that were put into place last year are fully being accounted for the projection for FY27.
Okay, thank you.
Thank you.
Thank you, Madam Chair.
Thank you. On that note, Ms. Howell, when did the new waiver go into effect?
October 6, 2025.
Is that when all of the cost containment measures from FY26 went into effect, or some of them?
So on the provider side, everything that took effect October 6th took effect October 6th. My understanding is from DDA and from other advocates is that on the self-direction side, families and people who self-direct were given the opportunity to not have certain cost containment measures take effect until their next plan came about. I don't know if that is true for every single person, but it's our understanding that people, and it's understandable, right?
Right.
People, we
Not
all
have
need
like a
time.
shock.
We all
Like,
need
yeah.
time to plan, whether it's in the provider model or in the self-direction model. So I'm not criticizing that. I'm just saying I think there was a difference between a kind of a one-day implementation on the provider side for some cost containment and some more grace given on the self-direction side.
Could that then mean that the FY26 cost containment efforts could not really be fully visible yet if some of those efforts are continuing to be implemented as plan years or PCPs are being renewed and provider kind of the provider side stuff mostly went in October, so we're not necessarily seeing like the full fiscal year impact from July yet, but we're seeing kind of a staggered approach.
That's how it seems, and looking at the analyst analysis, you see that for the one item, I think the wage issue or the wage change, reasonable and customary for self-direction, achieved much less in cost savings than was projected by DDA, and I think that's probably because of the rolling implementation tied to plan. So it's an excellent question of making sure that those I don't think anybody wants to see more cuts than need to happen in the DDA programs, and so we want to make sure that any cost containment is actually really fully accurately projected for 27, so you all don't cut more than you need to.
That's really helpful. I think to the MDH team that is here, perhaps if you're able, after we hear from advocates, to come and speak to this question, that might be very helpful. Thank you, panel. Really appreciate your testimony. We'll take the next 4 who have signed up. We have Virginia Cass, Andy Culp, Robert Malone, and Peter Mates, perhaps, with SDAN. 2, 3, 4, great. And yeah, you can sit wherever you want. Yeah, and then once you're seated, you may begin, ma'am. Okay, and while the others are getting ready. Thank you. Whoever is ready to begin can kick off.
Good afternoon. My name's Jenny Cass, and I'm here with my husband, Bob, to testify on behalf of our 34-year-old daughter, lifelong resident of Baltimore County, her agency and itinerant in Baltimore, and the other community service providers in Maryland. Let me tell you about Megan. Meg is on the autism spectrum. She wears beads, lanyards, and scarves, as many as she can fit around her neck. She carries a beloved stuffed guy with her wherever she goes. Meg is kind, gentle, and full of love. Her cognitive and developmental delays and her repetitive behaviors do not diminish her humanity. But Meg knows what it feels like to be left out, to be underestimated. Meg is like me, her dad, her sisters, and she's like all of you. She needs friendships, purpose, and community. Her provider makes this possible through day and residential supports with trained staff who understand autism. Meg lives in an apartment with 2 other lively young women with 24-hour support who keep them safe. Across Maryland, more than 15,000 people rely on DDA community providers. The governor's proposed budget reductions would significantly cut funding to those providers, especially for individuals who require 1-to-1 and 2-to-1 staffing, in other words, the people with the highest needs. Reduced staffing is not an abstract policy change without significant risks. This proposal frankly compromises client safety. Consider times of emergency when seconds matter. Inadequate staff ratios is like playing with fire. Let's say there is a fire. Will everyone make it out? Raising Meg has been a privilege. She has taught us patience, sensitivity, and what it means to stand up for someone who cannot stand alone. But families also cannot stand alone. We need support. Together with our devoted community service providers, we are a village for Meg and all the other individuals who receive support. Please do not move forward with these proposed budget reductions. Find another way. Protect Megan and thousands of Marylanders like her, that their lives, their safety, and their place in our community depend on it. Thank you.
Good afternoon, Chair Shetty, Vice Chair Jones, and members of the committee. My name is Andy Culp, and I'm the Executive Director of the ARC Maryland. And you have my written testimony in your packet, and I just wanted to echo all the sentiments that you've heard before, so I don't, repeat them. But all of these cuts, all these proposed cuts, are going to deeply hurt all people, regardless of model of service. But I want to address a concern expressed by a member of the committee with the costs for community provider model, because I think that is a huge question. So first, 80% of all people who get DDA services, that's over 14,000 people, access their services through the provider model. And these are typically older people on average with age-related health needs. Many do not have family to help with their supports or have supports needs that exceed that which their family can manage. And there are several who were formerly in institutions in Maryland that we closed down. Also want to share that the provider model is a highly regulated model with administrative and reporting pressures that don't exist in the self-directed model. And that's not to disparage a self-directed model. It's a very beautiful, flexible model. But the reality is that these pressures are DDA imposed. They are in response to federal requirements for licensing and certification. And the community provider model has, in the black, has extensive training requirements. The red box here shows training requirements imposed under the self-direction model. And then regulation and oversight, again, very different in the provider model than what exists in the self-direction model. And these mechanisms cost money, right? Plus all of the other factors that I previously touched on. I think without my bell. So I'll just close to say that we don't want anyone getting hurt. We don't want to pit one model against another. I think these changes that we need to make need to be very thoughtful. There needs to be a lot of investigation into the human impact of any change, and that hasn't happened yet. So I would respectfully request the committee to take a look at that, and I thank you for the opportunity to testify today. Thanks.
Hello, Madam Chair and members of the committee. My name is Peter Mattis, and I serve as the Executive Board of the Self-Directed Advocacy Network of Maryland, SDAN. You have my written testimony. After today's panel of DDA, I'd like to just put that aside and just make a couple comments of what they said today. I have been in the life and health underwriting business for the last 43 years. The last 6 years, I do sit on as appointed to the Maryland Insurance Administration Advisory Group, and I know insurance inside and out. We get a lot of complaints from a lot of families when they try to get their health insurance because they're saying they're providing benefits. They're not. What's happening is they're asking for a lot of cumbersome information to delay the process. If you go to a doctor's office or you go to a hospital and you hand them your membership card for your health, they will take care of you. Well, that's not enough for them. They don't just want the membership card, they want the copy of the actual policy. Now, how many of you can produce the actual copy of your policy from your health insurance? I know with Care First, they send it out 2 or 3 months later in the mail, if you're lucky enough to get it, and people just file it aside, and that's it. That's not really fair. They offer no dental, no retirement, no disability insurance, none of the things that are offered by people in institutional classes for the rate class that they're trying to justify a decrease down to $18 an hour. These are highly skilled people that are working with disabled people. Why do we expect them to work for babysitter wages? This is really not fair. Thank you very much.
Good afternoon, Madam Chair and Vice Chair and committee members. Thank you for this opportunity. My name's Rob Malone, and I lead the ARC for Prince George's County. I just want to point out a couple of facts from a provider's perspective. Hopefully it will be helpful in your deliberation. So I can affirm that the budget cuts for providers did take effect this year because I'm a provider. This year alone, our organization absorbed a $4 million rate of annualized revenue reduction, mostly due to, I believe, the geographic rate differential. We will finish this fiscal year at about break even. The proposed cuts for next year will push us into an operating deficit. Our staff will go 2 years without wage increases. And we have been looking at every category of services provided through DDA, and every one of them is down. Year to date, July through December, we're down 2.2 million. So we're on track for a 4 million cut. The second thing I want to do is connect with a point that came out earlier. I want to paint a scenario. I want to raise how unfair and illogical it would be to arbitrarily cut budgets of people that exceed $500,000. Many of those budgets exist because of the complex structure of the DDA waiver, which Laura talked about. In order to have access to services, we need providers to stack services, which we were told to do, many of which are not accessed. Okay, so we stack services, but they're not all used, if that makes sense. DDA knows that approximately half of those budgets are not spent, but without any analysis, when you say you are going to cut budgets of $500,000, you end up removing choice and access to services that people really need. That has been said. You can have someone with a budget of $600,000 who only spends $300,000 ultimately get their budget and access to services cut to $200,000, while a person with a budget of $400,000 spends $350,000, sees no impact or change at all. It's completely arbitrary. It's simply unfair and not well thought out. I'm going to skip to the last thing, and I'll close with this. I'll paint a scenario. Joe is someone we support at the ARC Prince George's County. He has been supported for 23 years. Joe has had dedicated supports for a long time. Supports which include in lieu of day services, which means he doesn't go to a day program, he stays with residential services staff. We provide meaningful activities. The dedicated supports are needed to assist Joe with his behaviors, which include aggression, property destruction, self-injurious behaviors, rectal digging, public nudity, elopement, and public masturbation. The staff maintains an activity calendar for Joe, and he also loves listening to Michael Jackson and board games. Given Joe's needs, he has supports during the daytime, evening, and awake overnight. His mother doesn't live in the area and has no other family involved. The question would be, would Joe be a candidate for reduction in dedicated supports? And if so, what happens to Joe? Thank you.
Thank you for your testimony, all very powerful. Thank you. Delegate Stanko for a question.
Yeah, thank you, and I appreciate that context and before getting the differences between a budget and an actual spend and the why. And I think to my colleagues' earlier comments on inequity in the distribution, right, how that can show up in the example you described. Is there, and not to put you on the spot, so maybe it's something we can come back to, but the thing is, like, is there somewhere around, is there some framework around what the ultimate pull-through is, which is the exact dollars spent, right? That like 500 is kind of arbitrary is the way I would put it, just other than saying like, hey, we want to make sure there's a cap? Is there a pull-through mechanism that you can think of, or maybe we can follow up offline to say actual dollars spent to get to?
I'm not exactly sure where your question is, but what I just want to share from my perspective, and this is just my perspective, any dollar cut impacts everyone's services, because what you do is you reduce the resources available to provide the support, which means, and you know the way DDA works. DDA works on a staffing ratio. So we have to meet certain requirements to keep staff in place. If I need 6 staff overall to support all these people, but I have $10 less, I still need 6 staff. And so I think any approach to cut these supports to people who have dedicated hours, who have assessed needs, who've had those supports for years and their condition hasn't improved, creates an impact, a ripple impact for everyone.
Yeah, okay, I appreciate it. And again, thanks for the enlightenment on the budget versus actual dollars.
Thank you so much, Delegate. Thank you for the answer.
Thank you.
Delegate Ruff, question.
Thank you, Madam Chair. Ms. Culp, thank you so much for your advocacy, and I wanted to just touch base on something you included in your written testimony. You were talking about how the General Assembly set the rate structure, and that, my take on your written testimony is that, we shouldn't be surprised that we're here with the, the costs that are presented before us. One thing that I wanted to get your further opinion on was your position that the state will be ineligible for federal matching funds, totaling additional loss to the DDA budget. Could you talk further about that and other aspects of your testimony that you may not have had a chance to touch on yet?
Yeah, thank you for that question, Delegate Ruff. The first part of your question, I think you're talking about how I described us getting here. It wasn't just this kind of overnight. I think a lot of emphasis has been placed on how much the DDA budget has grown without enough emphasis being put on the fact that we just went through this 10-year extensive rate setting process that was ordered by the General Assembly in 2014, got underway in 2015, sort of wrapped up by 2025. So a lot of man hours, woman hours, and money put into this process to come up with fair and reasonable rates. In the middle of all that, we had a pandemic, obviously, but also we had several increases to the Maryland minimum wage. And when the Maryland minimum wage increases, Medicaid providers, as contractors of the state, have to adjust to those pressures, and so the rates were adjusted to respond to the increases in the minimum wage. So that's why I'm saying it should be no surprise that we're here, and the jump from people going from PCIS-2, which was our legacy billing system, into LTSS made people eligible for those new rates, and that happened right around the time you see the rise in expenses. So it's not a runaway train. It was a predictable thing that people are and providers are able to access appropriate rates. The second part of your question, which I won't belabor because I don't want to take up too much time, but I was pointing to dedicated hours cuts through DDA's own contractor data that's available on Hilltop Institute, and it shows that from September 2024 to September 2025, despite having direction from the General Assembly, from the Budget Committees actually, that DDA couldn't require the use of shared hours before a person could access their dedicated hours, that the rate cut was, that we received was the cost containment, we continued to see cuts in dedicated hours for people who had medical and behavioral needs. From September 2024 to 2025, dedicated hours users decreased by 76 people for 1-to-1, and 45 people for 2-to-1, I believe. So, and the expenses also decreased during that time. So that's in your packet. And then the JCR responses that you all received in August and November also don't follow the information that was provided to the analysts, and that the projections keep moving. It just doesn't add up. So we just think a lot more attention needs to be given to these proposals to make sure we're not double and triple cutting a system that's already experiencing these cuts that have been implemented since October.
Thank you. Thank you, Madam Chair.
Thank you for your question.
Thank you, Delegate. Thank you, panel, for your testimony. We really appreciate your ongoing advocacy. I'm going to call the next four to the table, please. Laura Lear from Community Support Services, Inc., Patricia Saylor, Self-Direction Advocacy Network, Alicia Wopat, and Michelle Stewart.
I guess I'll start. Chair Shetty and esteemed members of the committee, I'm Laura Lear, the CEO of Community Support Services. The proposed DDA budget will significantly impact Maryland citizens with the highest needs. For decades, community providers have moved Maryland forward in advancing the care of people with developmental disabilities. Thousands of Marylanders moved from segregated state and private institutions to community-based services. Maryland moved in the right direction. The provider community has moved Maryland forward in building a highly skilled DSP workforce fundamental to the well-being and success of people with developmental disabilities. Providers continue to invest in professionalizing the DSP field. Maryland is moving in the right direction. Providers have moved Maryland forward in the inclusion of children and adults with disabilities in school, work, and community life. People live in their chosen communities with individual schedules supporting their person-centered plans. Our meaningful day services provide social and recreational activities, and 90% of people have paid or volunteer work experiences. Maryland is moving in the right direction. Providers have moved Maryland forward by bringing millions in federal grants and fundraising to supplement state funding. Providers must find resources beyond DDA funding, as services do not include housing costs, and residential services are funded at 87% of the rate. Fully funded rates are needed now to move Maryland in the right direction. Providers have moved Maryland forward by delivering lifelong, sustainable services. Providers often become a second family, supporting individuals as they age and as their parents age and pass away. Providers extend support beyond DDA waiver services. They assist with Social Security benefits, healthcare choices, nutrition, personal finances, ensuring stability and continuity of care. Maryland is moving in the right direction. Significant work remains. Reports show DDA is leaving waiver slots unfilled. Maryland can repair fiscal inefficiency without dismantling the lives of our citizens. Cutting $150 million to lose $150 million in the federal match isn't fiscal policy, it's doubling the damage. Protect this funding, keep Maryland moving in the right direction. Thank you.
Hello, Chair Shetty and esteemed committee members. My name is Patty Saylor. I'm a nurse. I work for people who self-direct their services. I've worked for over 260 people in the last 20 years. My son was also a self-directed participant when he was living. I represent the Self-Direction Advocacy Network, and we've been working very closely with other advocates and the department for years now. I'd have to say in the last couple of years we haven't made much headway. I can respect, and I do respect, the leadership of DDA, and I respect the fact that they meet with us regularly, and they have held over 94 stakeholder engagement meetings last year. It reminds me, though, of something Speaker Penny Melnick said to me at a fundraiser probably several years ago, when she said, "When my phone is blowing up, I know that people are not okay. So I know that you know that people are not okay." So we have a bigger problem, I think, not bigger problem than the money, but a big problem, that if the department is working so incredibly hard at engaging stakeholders, and I know myself as a volunteer attend many, many of those meetings, we still aren't getting through. I don't think that people feel they're getting through to the department, despite all of that effort on the department's side. I was there in the evenings when they come to Western Maryland and have evening meetings, and I'm thinking, oh my goodness, if that was my job, I might not want to do that on a Tuesday evening. So the effort is very obvious, but the outcome is not very good.
people said repeatedly through every one of these meetings that I've been in is do not cut self-direction wages. That is the one thing we need. That's what attracts the staff of high quality. That's why I can keep the staff of high quality. That's why my son or daughter is okay. That's why I can quit my job and take care and provide the supports when I cannot find staff. And the one thing that department has come out in this proposal is to cut the wages tremendously. So we can expect that the staff that exists now who took a cut last year to their paycheck, they will take another cut this year to their paycheck, they will leave. As a nurse and a person who cares deeply about people with disabilities, I'm terrified because the cuts that are proposed will result in some tragedy. And I'm very, very frightened for the people that I support. That does not say that we do not need to tighten our belt. We can need to look at alternative measures. As SDN, we're willing to work with the department and commit to looking at longer term, really dig into the alternatives that we can look at making self-direction even more affordable. Thank you.
Thank you, delegates. I appreciate the opportunity to be here. Thank you, Chair Shetty and Vice Chair Jones. I appreciate it. My name is Alicia Wopat. My son self-directs his services, and I too am on the board of the Self-Direction Advocacy Network. We all understand that Maryland is under some financial pressure, but cost-cutting in essential services has to be done with precision, with consensus, and most importantly, with a focus on the people. And the current DDA proposal does none of those things. The proposal reduces the DDA budget by cutting the direct support professional wages, which Patty has already explained has been done before, along with the benefits. Both were cut in the last 6 months. These cuts affect the 4,000 and plus Marylanders who self-direct, and there are almost 10,000 employees. So it's a pretty good-sized chunk of people who are going to feel the effects of this proposal. And the Bureau of Labor Statistics really don't have a category for this particular type of work. One of the things that came up to my mind when they were talking about the $23, my son was paying his staff $22.83 in 2019. That's crazy. That's just crazy. When wages are cut, the DSPs are going to leave. Turnover is not free. It costs training costs, administrative churn, service instability, and people's instability. There will be a loss of community integration and a high risk of crisis. And crisis costs show up in other places. So this is not a free exchange. If reductions must occur, they should be targeted and developed with consensus from the people who are using the programs. So I just wanted to, again, ask, no cuts to DDA budgets, certainly no further reductions to the wages of the people who do this work every day and who make my son and all of the people in this room safe. Thank you.
Good afternoon, members of the committee. My name is Michelle Stewart, and I am the proud parent of my son, Zachary, who joins me today. And with your permission, Delegate Shetty. Zachary is here, and he has prepared a few words that he would like to speak after I get done. So with your permission, if you could come down after I'm done. Thank you. I am speaking on his behalf because the choices being made today shape his life now and his stability moving forward. Zachary is an autistic adult whose needs require coordinated supports. For most of his life, his needs were primarily medical. For over 18 years, he was supported through the Model Waiver Program. So navigating waiver services and the Maryland Department of Health Systems is not new to our family. Before entering DDA, he was served through the mental health system, which was not equipped to support his needs and led to repeated destabilization and crisis. When Zach entered DDA services in 2020 at the age of 30, he began in the traditional provider model. Multiple providers across the state screened him, but none could meet his level of support needs. After exhausting all traditional options, self-direction became our only viable path in 2023. And I want to be very clear, self-direction works for Zachary. It works because it relies on consistent DSP staffing, behavioral supports, and rate structures that keep qualified workers in place. Zach's stability reflects his hard work and workforce investment. What I find deeply troubling is seeing wage reductions and benefit losses that directly correspond to that progress. I understand compliance requirements. The issue is how these changes are being implemented. Cutting workforce supports after progress puts that progress at risk. Destabilizing his supports risks sending us back to a level of cost to the state through inpatient hospitalizations for behavioral health crisis. More importantly, it would be inhumane to do that to Zach. Protecting what works prevents crisis, reduces cost, and preserves dignity. And it is my son's dignity and the dignity of all self-directed participants that need and deserve services that I am here fighting for today. Thank you.
Zachary, you want to come join your mom? Oh, well, hold on, I'm so sorry. I didn't mean to have the whole panel leave. We might have questions for you, so if you don't mind staying close by. Just wanted to have Zachary join us so he can share his comments if he wanted to.
Thank you.
You're welcome. Welcome, Zachary.
Hi, my name is Zach. Self-direction has saved me. It helps me make better choices because I have my support person with me. I feel safe and confident when she's there. I have worked hard with my behavioral specialist, Ms. Marla, and I have made a lot of progress. Now I am looking for volunteer opportunities in my community with my support person. I trust her, she understands me, and assists me when I need it. Her wages matter so I don't lose the support that helps me make good choices in my life. Thank you.
Thank you, that was really powerful. Okay, for you, we will definitely clap, yes. Thank you. Thank you so much, Zachary, for joining us today and for sharing your statement. We really appreciate it. I saw that are there questions from the subcommittee for this panel? Okay, thank you all. Thank you, sorry for the fire drill. Appreciate you all very much. Okay, we're going to go to the next panel of 4, and that will be Steve Keener from Jubilee, one of my constituent organizations, Crystal Jones, Richard Colm, and Angela Nopenberger. Let's see. 1, 2. Nopenberger is here. Okay. Sorry, I just want to make sure. We have 3 people coming down. So we see Steve, Angela, Richard. Is Crystal Jones here? Okay, we're gonna go to the next person on the list, Matt Rice. People on the go. Welcome. You may begin, and we will. You all have 2 minutes to go. Thank you.
Good afternoon. Thank you for this opportunity. My name is Rich Combe. My deaf-blind daughter, Kate, gets DDA services and self-direction only because of many rejections and failures under traditional. Once again this fiscal year, Kate's team faces disproportionate cuts to DDA and even more disproportionate, crippling cuts to self-direction to try to protect the traditional agency bureaucracies. $60 million off less than $300 billion versus $54 million off more than $1.2 billion. I'm here to ask you to reject these complex, unfair cuts, and if needed, replace them with a simple, across-the-board cut of 3% to 5% to the provider rate used to determine budget for both self-direction and traditional. The current self-direction wage levels are needed to provide appropriate care for Kate's complex healthcare needs. In traditional agencies, our issues were caused by inadequate staff compensation due to high overhead. The wage rate was so low that even with benefits, total compensation was not enough to retain and motivate staff. Now in self-directed, DDA has arbitrarily restricted staff benefits and simply banned standard staff benefits like dental or vision coverage. With benefits extremely and unfairly restricted like this, wages would need to stay higher in self-direction to retain staff. One of DDA's proposed cuts is a cap of $500,000 on total budget. So how will DDA implement this? Cut approved hours? Cut wages even lower for the most needy? This proposal is not only inhumane, but impractical, and it will bust the already failing LTSS system and bust the personnel budgets of DDA trying to administer this mess. The proposed FY27 cuts are again harmful and disproportionately targeted at self-direction. On top of last year's cuts, this would lower wages to where we would lose staff and have great trouble hiring replacements. Rule changes, delays, and budget restrictions are already doing great harm to self-direction. Please reject deep, wage-related budget cuts to the small, cost-effective DDA program, which is self-direction. Thank you.
I'm Steve Keener, the Executive Director for Jubilee Association of Maryland. I want to say 3 things about the proposed dedicated hours policy change. Number 1, the policy change is essentially a steep rate cut, decreasing funding by about $50,000 per participant per year for the same services. Put differently, we will provide over 1,000 unreimbursed service hours to each person each year. Number 2, DDA's estimate of $54 million of savings may be an understatement. If providers are paid $50,000 less for each of the 3,800 people impacted statewide, the total would be $190 million, more than triple DDA's estimate. Number 3, the consequences will be fewer service options for people with higher needs and less pay for their staff. The policy will actually incentivize more expensive service options, such as one-person homes and day programs for retirees. There are better ways to find savings. For example, DDA could modestly reduce the glide path percentage for the rate for dedicated hours or for personal supports. This would more evenly and predictably achieve savings without undermining the service structure. Another savings option, MDH could help state-funded participants enroll in the Medicaid waiver. Last year, MDH asked people to apply for the waiver, but gave them little time and little help. Most were denied or remain pending in the system. If MDH would deploy subject matter experts to guide people through eligibility enrollment, the federal Medicaid match would save the state millions and harm no one. I realize my testimony was a little dense. You have my written testimony for more details. Thank you.
Good afternoon, delegates. Thank you for having me here. My name is Angie, and I have 2 disabled teenagers currently using the self-directed service model. I'm coming to you today to fight for them since they can't use their voices to do so. I can't believe that we are having to come again to fight for a population of people that have the kindest hearts and just want to be given equal care. Both of my children have a dedicated one-on-one at school, but require 2 to 3 additional staff when their behaviors are at their worst each day. And yet DDA says their needs are not severe enough to justify services they have received for years. Would it be better if my children were just institutionalized and would cost the state another $150,000 a year? What is happening here? I am a social worker in Baltimore City. For over 24 years, I have been a dedicated mental health therapist helping families in many difficult situations. I am also a personal support for both of my kids, and this is the most challenging support I provide. Being a personal support requires you to be constantly thinking out of the box, be sharp, present, kind, understand their needs, and do this in a matter of seconds all of the time. This important job should not be facing pay cuts of 30 to 40%. While a written testimony is important, I think the gravity and severity of this current situation deserves to be heard from a human voice. I'm begging you to take a few minutes and ask me how DDA's actions are impacting my family. I am speaking out because my situation is very similar to many of us here.
Good afternoon, Chair Shetty, distinguished subcommittee members. My name is Matt Rice. I am the Executive Director of People on the Go Maryland, which is Maryland's statewide self-advocacy organization ran for and by those with intellectual and/or developmental disabilities. I'm here to ask you once again to reject harmful budget cuts to over 19,000 Marylanders in both of DDA's service models. The reality is we have been told that we need to do this in order to keep our federal authority. Well, we've seen that long before the present administration came to power, the emphasis was on cutting costs. You have my written testimony with my personal story about that. I will say the situation is not unique. I'm also proud to work with both people in the self-directed and in the provider-supported model. I will not call them traditional because they don't like it, and I don't think many of them are. But the reality is cuts to direct support professional wages are not the way to do this, regardless of the service model. I have my direct support with me today. Idris, please stand up and be acknowledged for what it is you do. This man is a father of two, and he supports his other family members. Without the rate I'm able to pay him right now, he will have to find other employment, which then means I am risking my employment, and that is not acceptable because my job is more than just my job. It is my calling, supporting over 500 people with intellectual and/or developmental disabilities. If you want to continue to support a taxpayer rather than increase a tax burden, please reject these harmful budget cuts. Thank you.
Madam Vice Chair for questions.
Thank you so much, Chairwoman. Thank you, Angie. Our meeting in my office with your husband and your teenagers and their self-directed person meant the world to me this year as well as last. I would like to ask you, have the DDA policy changes over the last year resulted in your teenagers losing services, and have you tried to appeal any of these decisions?
Thank you, Delegate Jones. I'm going to try to say this in a very concise way. I can think of 3 ways that our services have been affected. First, DDA is denying or asking our kids to remove personal support enhanced services without telling us specifically why or giving us a chance to update documentation. It's happening to many people, not just our kids. Second, they completely destroyed the day-to-day admin position. This was a really valuable service that the General Assembly specifically broke out as a separate line item. But now funding is limited 10 hours per month. They can only do a small list of very specific things like scheduling lawn care, furnace checks, or snow removal. They are saying personal support should be doing household chores, cleaning, cooking, shopping with our kids. But with behaviors, physical limitations, and needing to be at arm's length, how can staff reasonably do this without another person to help with household management? Third, there is a service called IFDGS, which is for the participant to choose items related to their disability using cost savings in their plan. DDA is using IFDGS rejections when we don't get the official letter and explanation for 8 to 10 months. The denial can be appealed, but that can take another 6 months for the hearing to occur. If the service is really needed, participants can't wait that long, and DDA won't cover if the approval comes after the purchase. So it's an impossible situation. And have we tried to appeal? Yes. But the appeal process is very stressful and taxing on families. It can take 6 to 9 months waiting for a hearing to be scheduled. And then when you go in front of the hearing, you feel attacked and vulnerable. Delegate Ruff, you were talking about disparities. Well, DDA provides a lawyer at these appeals. It would require a family to pay for their lawyer to handle the back and forth that happens. It's terrifying to be in front. I was in front of a judge and I literally cried for 2 hours. We did not have a lawyer. But imagine the income disparities for people who need a lawyer but can't afford one. So even from what we have heard from other families, you are ripped apart in front of the judges. They will ask caregiver history instead of focusing on the participant and their needs. And while they are waiting for the hearing, the services are not provided to the participant or DDA. And this will, I'm sorry, I've lost my organization. I think I named everything.
A follow-up, I have to reiterate on the record. You said it at the beginning of your testimony, and you said it in my office, and I know this to be true. Every single parent that I have talked to in my office, at the supermarket, at my son's school, have to become experts at navigating a system. You have been a social worker in Baltimore City for 24 years. Your ability to navigate systems for other families is tremendous in and of itself. But it sounded, even with your 24-year history of being a social worker, serving the state of Maryland in Baltimore City, that this was many times overwhelming and untenable. Am I misclassifying your family's thoughts and private conversations with me?
You are not. Thank you, Delegate Jones, as I'm speaking on behalf. Our personal supports save us. Save us. I would not, if I did not have my personal supports, I could not take care of my children. They could not live with us. Can you imagine not tucking your children in, 19 and 16, into bed because you cannot handle them? Our personal supports who are trained in advanced MANT, they help us so that this does not happen. And we will lose them if we have to cut their budgets. They will not be able to survive and afford an income to afford paying for things in this way. And yes, I am a social worker. I'm a licensed social worker. I've been doing therapy in school-based and in federally qualified health center. I have seen it all. And this, by far, supporting my children, is the hardest job I have ever had to do.
Ms. Knoppenberger, thank you so much. Your voice, and for all of those at home that could not manage coming today, and for their families, thank you so very much.
Thank you so much, Madam Vice Chair. Thank you to this incredible panel. Any other questions from this subcommittee? Okay, thank you so much to the panel for your stories and your advocacy. We will now go to the next 4 individuals listed. I have Cody Stevens with Concerned Citizens, Josh Delclose, Jean Legal, Beth Good. Yes.
Shall I start? My name is Jean Legal. I'm almost 80 years old. I'm also the mother of a 50-year-old son with severe developmental disabilities. My son's name is Eric. He's lived with us until he was 25 years old. He's nonverbal, completely unable to take care of himself. Eric can be funny, he can be gentle, he lights up when he hears music, he smiles when he goes to the park, he loves visiting his mama. Eric's disabilities are profound. When he becomes overwhelmed, he can bang his head or shout and injure himself. He requires constant supervision. He cannot be left alone. I love my son with all my heart. I cared for him at home, but at almost 80 years old, I no longer have the strength to safely lift him, steady him, protect him. That is why DDA services and community providers are not just programs to families like mine, they are lifelines. The staff who support Eric keep him from falling and prevent him from injuring himself. They make sure he's clean, comfortable, and treated with dignity. They bring him into the community so his life is just not confined to 4 walls. They laugh with him. They give him structure, stability, and safety. There are many adults like my son with complex needs. There are many parents like me who lie awake at night wondering what will happen when we're gone. Community providers rely on stable DDA funding to hire and retain trained staff. With less funding, there are lower wages, increased staff turnover. With increased turnover, there's less stability. Cuts to DDA funding are not abstract budget decisions. They affect thousands of people. They affect aging parents who live with constant worry about the future. Every parent wants to know that their child will be safe when we're no longer there. I'm asking you today, please protect my son and families like mine. Thank you. And he's cute.
There he is.
He's sweet.
Well, I guess while we're sharing pictures, this is my son Luke when he realized that he was about to have a baby sister. Okay,
Oh,
he's
thank
big brother
you.
now.
Thank you.
Yes, ma'am. Chair, Vice Chair, members of the committee, my name is Cody Stevens. I'm a regional lead for Concerned Citizens of Self-Direction. I'm also a member of MedSec, so any questions you have on that, feel free. Okay, but first, I'm here as a father. My son Luke lives with severe epilepsy and complex medical neurological disabilities. He has undergone 2 major brain surgeries, including a full right hemispherectomy, before the age of 10. His day-to-day needs are unpredictable. His safety depends on trained, consistent support staff who understands his medical complexities. When the state imposes deep budget cuts on the Developmental Disabilities Administration and the DDA responds by drastically cutting wages, creating budget caps and restructuring supports, those are not administrative adjustments to participants. Those are direct threats to their safety and their stability. Under the Supreme Court's Olmstead decision, Maryland has a legal obligation to serve individuals with disabilities in the least restrictive setting appropriate in their homes and communities, not in institutions where I promised my son he would never go. We're already operating in a system under strain. Nationally, the direct support workforce has experienced vacancy rates exceeding 20%, with turnover often above 40% annually. When you reduce wages further, you don't create efficiency, you accelerate the collapse of these programs. When experienced staff leave due to rate cuts, when participants cannot recruit or retain qualified caregivers, We are not moving forward. We're violating the spirit and potentially the letter of Olmsted. In 2022, Maryland passed the Self-Direction Act, affirming the individuals with disabilities have the right to control their own services and direct their own care, grounded in dignity, autonomy, and person-centered planning. But what does self-direction mean if the resources behind it are starting to be stripped away? Self-direction without sustainable funding is not empowerment. It is instability placed on a community already carrying enormous weight that only very few will ever truly understand. Across this state, participants are losing staff, parents are leaving the workforce, participants are losing community programs, therapies, and routines they took years to build. Entire lifestyles are being upended in mere preparation for these cuts going into effect. Many participants cannot stand here and explain what happens if their supports collapse, but many of us can. We're not asking for excess. We're asking for compliance with federal law. We're asking you to uphold the promises made in the Self-Direction Act, and we're asking for safety, dignity, and stability of the thousands of participants these cuts will endanger. Please do not balance this budget on the backs of those who cannot defend themselves. Behind every line of these budget items is a life. And behind this microphone is a father and a group of people behind me telling you that there's thousands of people that these changes are going to threaten. Don't let it happen, please. Thank you.
Thank you.
Thank you to Chairwoman Shetty and all the members of the committee. My name is Beth Goody. I live in Rockville, and I'm representing my daughter Caroline Monroe, who also lives in Rockville, using a housing choice voucher. Caroline is 31. She's totally dependent for all aspects of her care, and she's been self-directing for about 10 years. And I think her story is in your packet, I hope, because she's got a pretty great life. I've been sitting here all day and listening to the testimony of the department and said, I feel like I'm living in an alternate reality. What I'm hearing from the department is not what we're living. They're talking about 94, all these community meetings. Everything's happening out here. We're getting stakeholder input. You know, I asked a question at one of the community meetings, and I was told, well, we're not answering questions today. And that's sort of the way it went. And then I have to thank this committee for the work that you did last year, because my intention was really to speak specifically to the role of the day-to-day admin. And a lot of work was done to restore funding. And then it basically was taken away. It's not useful. My daughter has a day-to-day admin who's currently paid for 12 hours a week. She has just blossomed and bloomed. She has worked for Caroline for 10 years prior doing DSP work. She was a roommate for a while. They own a pet together. She is really able to take on this role, and she's going to lose it, and she's going to lose the job. And, you know, is she going to come in for 2 hours at 7:45 in the morning for half the wages that she's making now? We pull that thread and the whole thing collapses for Caroline. And I just don't know what's going to happen. Would love to see some sort of amendment reinstating the day-to-day admin. And another thing very important is to restore language unless otherwise authorized by the department. And thank you for your time.
Good afternoon, Chair Shetty, Vice Chair Jones, and members of this committee. My name is Josh Stoklos, and I am 39 years old. I live in the Arc Northern Chesapeake Region's Community Living Program. I started receiving services through the Arc in 2014. My journey navigating residential services started when I was in my early 20s, but was not successful at that time. Then in 2022, my mom had a health scare. I realized then that I needed to get serious about finding a residential program while my parents were still alive. Life happens. Our family members get older. They die, and there's no one else to take care of us. We need these supports to fill that void when our family members pass away. We need these supports to ease the burden off our families. I eventually found the ARC I eventually was accepted into the Art Community Living Program, and it was life-changing for me. The Art Community Program helps with affordable housing, transportation, and other important supports. Last year, I almost lost my Medicaid waiver eligibility because my application to EDD was not approved timely, and as a result, I was almost kicked off the waiver. Fortunately, my parents knew a lawyer at Disability Rights Maryland. She helped me retain my eligibility. However, this process took months to resolve and caused me and my family a lot of stress. I want lawmakers to imagine being in my shoes. How would you feel losing your home or your services? These budget cuts make me worry very deeply. I feel just like I did when I got almost kicked off the waiver. Please ensure that you protect people with disabilities and fully fund our supports and services. We, the disability community, cannot do this without you. Thank you for letting me speak today.
Thank you so much for your powerful testimony. Delegate Ruff for question.
Thank you, Madam Chair. And I don't actually have a question. I just wanted to applaud everyone and echo the sentiments of our appreciation for all the advocates on this panel. I just wanted to also excuse myself and Delegate McCaskill. We actually have to go to another meeting. Briefly, we may be able to come back and join you all for the finish of this meeting, but did not want to leave without advising you all and also thanking every single one of you. If we're not able to return, certainly everyone, we've heard you, and we will do our best to make sure that we hear the testimony that we're going to be missing as we go to this next meeting. And with that, I would thank you guys again and ask for permission from the chair to be excused.
You have my permission. Yes, thank you.
Thank you.
Delegate Stonko has a question for this committee, ma'am, if you don't mind. Thank you.
You mentioned you're on the MidSec. Can you just talk to me about holistically your experience serving that capacity and opportunities for improvement going forward on anything you see fit worth sharing?
Sure. The understanding of what MidSec was supposed to accomplish was to understand the need of matching and getting into cost containment while still trying to minimize the damage done to the supports. We ended up being a better group. By the time we included providers, it was over 20 that were in there. We were offered an opportunity to make suggestions that we deliberated. In that time, we had, if I recall right, anywhere between 28 to 30 different suggestions that we did have kind of a round-robin vote upon. I do know that there were many of those suggestions that were not included in that 28 to 30. So there were some that were not brought to the table in general. Out of those, the understanding was that we were going to move forward with some, and then depending on how the voting went, others would be sent away. I can say out of the three major pieces of this proposal, none of those three showed up in the MidSec meetings. None of them have been discussed. This was an action from the DDA. This was not stakeholder movement. So with that, when this came out, not only was it a shock to the members of the MidSec, but there was a follow-up email to the entirety of the DDA suggesting and showing appreciation for our recommendations regarding these cuts, which only seems like gaslighting. So I can personally say that I believe that the MidSec really did not accomplish much at all. I do know that there are other members in the room, and as they have an opportunity, if they bring up the fact that they're MidSec, I encourage you to ask them as well. But every indication is that MidSec matched the conversations that we had with these listening sessions and these community meetings. They were accomplished, they did occur, but we really didn't get far.
Okay, thank you.
Thank you, Delegate. Thank you for your testimony. Seeing no further questions for this panel, I want to thank you all so much for joining us today and sharing your story. Thank you. We'll go to the next four on our list. Jane Moncure, Robert Stone, Hannah Cerrito, Charity Hildebrand. Welcome.
Would it be acceptable if my daughter co-opted a little of my time?
Of course, we welcome your daughter. Thank you.
Just we'll switch chairs.
One moment, we have Joe to the rescue. Give us one moment. Yeah. Would you like
This
to
is
sit
her
next-
aid.
Yeah,
Her
okay.
aid's with
Oh,
us.
got it.
That's her aid, and she wanted her aid.
Oh,
Strong,
perfect.
Okay.
Yeah.
And do we have someone else? All right, well, I guess we're all here.
Thank you very much. Thank you. Thank you, Joe. All right.
Thank you so much.
Welcome.
My name is Jane Moncure. I am the parent of a 33-year-old daughter with cerebral palsy. We began self-directed services after my daughter's traditional provider exited personal supports due to financial difficulties resulting from the list payback. I am here to speak against the proposed pay cut for self-directed staff. I'm a former finance executive for the school system, an insurance company, colleges, and a public mental health agency in Baltimore City. In these many roles, I have developed salary scales, and although I find DDA's intention to benchmark salary scales understandable, I think their execution is flawed. They focus on a poorly responded to salary base. The labor pool for DDA aides is strictly local. Likewise, I believe pay comparisons should be local. So I looked up the Baltimore County School District pay scale for their para-instructional staff. These are the staff members who provide one-on-one support to our children in the school system. I believe this is a more suitable benchmark. Para-instructional staff receive a minimum of $21.33 an hour for a first-year hire with a high school education, and extends up to $34.83 an hour for 10 years experience and a bachelor's degree. The current pay cap of $32.45 for self-directed CDS workers falls comfortably within that range. These school employees are part of the same labor pool that we as self-directed employees compete to hire. The school system's benefit package is much more generous. Our employees must have an individually purchased health insurance plan in the market, which can cost up to $15,000 a year. We can reimburse them maybe $200 to $500 a month. They can have no dependent care. They have no retirement care. They have no educational support. School system will provide some tuition reimbursement. They also work alone in a home instead of in a school system where they're supported by other professionals and paraprofessionals, including custodial and security staff when needed. Our labor market is tight. With traditional services, my daughter missed weeks of services because her agency was unable to hire appropriate staff at the prevailing wages, even though they, too, offer more generous benefits than we could afford. My daughter was also on the waiting list for 12 years before she received services. I would like to note that the department has not proposed grandfathering existing staff. In the school system, when we move someone to a lower-paying job, we would grandfather them and wait for the salary scale over time to catch up. When organizations deliver pay cuts, valuable employees quit. And can any of you imagine having to tell your coworkers or your legislative staff they're going to take a 30% cut in pay? Please return this budget to DDA and direct them to come up with a more suitable plan. And I included in my written testimony to the Senate the salary chart that I addressed.
Okay, we'll ask them to share it with us. Thank you. Thank you.
Okay. You want to read your statement?
Good afternoon. My name is Miriam. but DDA wants to cut their pay. So they want to cut me. My one brought me here today to me with Trey George because he just put me on the board of a nonprofit called the Freedom Channel. My other aide came in to a retirement home at my internship. My feel is that they were clear because they have family and the culture living in unsafe. They will have to get a non-job to support their family. Please don't cut their wages. And I also have mental health, which is also very important because if you don't know what mental health is, I mean,
No ad-libbing.
Thank you so much for your testimony. You did a really beautiful job sharing your story. Thank you so much. Thank you. Yes.
Good afternoon. My name is Charity Hildebrand. I am a mother of 6, 4 children on the spectrum, 2 that receive DDA services. We arrived in Maryland in 2010 from Germany. My husband and I are both prior military. We're both veterans, disabled veterans at that. It took us 10 years to get services here in Maryland, and our 21-year-old has been on services, well, in DDA for 4 or 5 years now, and we have now been denied services because they're saying we don't show enough need for it. So we're in the appeals process. And even though we had 10 months worth of data, 27 pages, and DDA says that they've talked to us, they don't talk to us. You have my statement, but I just wanted to share a little bit about, the process so you guys kind of can understand what we go through. We talk to our CCS. Our CCS does up the paperwork. We sign it. We do it as a team. We sign it, and then we wait. And then the CCS gets a message and says, not enough information. And we don't know what it is sometimes, and so we add more. And then we get another denial back. Not enough information, whether it be awake overnight services or whatever. So then we think, okay, we'll add more. So we add more, and we get back not enough information. So we add more. And then we get the same reply back, more denials. And then after the third denial, we're denied. and then we have to go into the appeals process. So my son was denied in early September. And we had the 10 days, and just so you know, when they send us the paperwork, there's nothing in there about 10 days. There's 20 days, there's 40 days, nothing in there. Unless you know, and you don't make it by that 10 days, you're going to lose services. There was nothing in there. I've read all the paperwork. I knew because I've been doing this for a while. And I got it in, my CCS didn't even know about the 10 days because she had never been through a denial. So we got the paperwork in, and we still have not heard a word about when our case is. Nothing. We're in limbo since September. So we are working on 2024 budget. His budget was denied in September for 2025, and he's a transitioning youth. So, you know, he graduates here in September, or not September, sorry, in May. We won't get any community services. And we're kind of, like I said, in limbo. And he's been also on the non-public wait list for over 3 years in Howard County. He's so violent and severe, we've had so many denials in non-public. So that's the main reason why we went self-directed. And that's the main reason why it's so important for us to keep our staff paid the way we pay them. We had to cut pay by $4 last year per hour. You know, I hire people that are single parents, you know, to take care of my kids. And it's important that we can't provide them with medical care. We can't provide them with overtime. We can't provide them with anything but a higher pay so that they can take care of their families. And it's important. And when I have to talk to we had a problem with FMCS where his budget was wrong, and because he's in this denial process, DDA wouldn't help us. So I had to pay over $12,000 out of my own pocket to cover his staff and fight the FMCS to fix the budget because they kept on saying, we'll go to DDA. And they said they couldn't, you know. So anyways, thank you for your time.
Thank you. Thank you for sharing your story.
Good afternoon, Chair Shetty and members of the committee. My name is Hannah Cerrito, and for the past 6 years now, I have had the privilege of serving as a DSP and vendor in Maryland's Self-Directed Services program under the DDA. For the last 2 years, I have supported 2 young men in Howard County, and it has been an honor to walk alongside them as they build skills, participate in their communities, and work towards greater independence. I am here today because I am deeply concerned, quite frankly terrified, about the proposed cuts to DSP wages within the DDA. If these cuts move forward, I am not certain I will be able to remain in this field or even in Maryland, and that really breaks my heart. Like many DSPs, I am already navigating Maryland's rising cost of living. After last year's reductions to wages and benefits, many of us are stretched very thin. Further cuts would not simply just tighten budgets, but they would push dedicated, experienced DSPs out of this work altogether. And this is not entry-level work. In self-directed services, DSPs implement detailed nursing care plans, they follow behavior intervention plans, monitor complex medical needs, and ensure that individuals we support remain safe and fully included in their communities. We exercise judgment. We carry responsibility. We build trusted relationships over many years. The consistency we provide is not simply a luxury. It is a foundation to health, safety, and dignity. When wages are reduced, turnover increases. When turnover increases, participants lose trusted and careful staff. Staff is compromised, progress stalls, care becomes fragmented. Participants and staff suffer. The individuals we support deserve stability. They deserve qualified professionals who can afford to stay. Our most vulnerable Marylanders should not bear the burden of budget shortfalls. I desperately, desperately urge you to preserve DSP wages and restore full funding to the DDA budget so that individuals with developmental disabilities and complex medical needs can continue receiving high-quality, consistent support they deserve. We must go forward, not backwards. Thank you so much for your time, your leadership, and for hearing us all today.
Thank you. Madam Vice Chair for a question.
Thank you so much, Chairwoman. And I apologize as I navigate and take notes. Charity?
Yes.
Thank you. I want to make sure that I have my notes straight here regarding your testimony. You spoke directly to the denial of services and the appeal process.
Yes.
Did you say that September was the last that you had heard regarding your appeal process?
Correct.
And it's now February and you are still in limbo?
Correct.
And did you state that there were 4 of your 6 children?
4 of my 6 children have autism. 2 of them are on DDA services.
2 are on DDA services,
Correct.
thank you. And is this a normal process for you to go back and forth in appeals process?
This is the first time that we didn't even change his.
If you could just come a little closer to the
sorry.
microphone for the record.
We didn't even change his personal center plan. His personal center plan is the exact same it's been for the past 2 years. And they just denied it. We actually had more proof this year. We had his behavioral support plan. We had 10 months worth of data showing his behaviors, overnight behaviors, and everything, and they still denied his overnight services and his enhanced services.
How long on average does it take for you to receive word back of denial? And is that the lag? Where's the lag? You spoke of 4 months lag right now.
Well, the lag is, now we're waiting for the justice system, I guess. We're waiting for the court system to give us a court date for when a hearing's going to happen.
Do you have any notice as to how long that might take?
We have no idea. I heard it could be up to a year.
Thank you. Thank you for being specific and sharing.
Thank you, Madam Vice Chair. Thank you for your responses. Seeing no further questions from the subcommittee, thank you all so much for joining, and thank you for sharing your story. Thank you. I'm going to ask if Robert Stone is here. I don't see any movement. Okay. Then I have Charity Hildebrand. Oh, I'm so sorry. I already called Charity. Oh, I'm sorry. Thank you. Stephen Kilpatrick, Jessica Gallatin, Michelle DeFeo, and B. Ann Vlierbon. I see three people moving, so I'm going to ask one more. Lisa Shames. Is there a Lisa Shames here? Yes, okay. I heard a yes, so, oh, great. Okay, thank you. Great. You may begin, sir.
Hi, Madam Chairwoman and committee members. My name is Stephen Kilpatrick, and I'm a caregiver for an adult with severe developmental disabilities whose life has been transformed through Maryland's self-directed services. When we began, my client struggled with extreme violence, arson, and pica. Through intensive round-the-clock support, we have achieved incredible success. He is no longer diabetic, and his quality of life has soared. However, his safety still depends on a specialized team that understands his triggers. Last year's wage cuts sent a clear message. The DDA does not value the professionals who do this strenuous and highly specialized work. Despite my passion for this client, I'm now forced to change careers because my family cannot survive the financial instability. If these proposed cuts are enacted, progress will be lost. My client's hard-won stability will vanish. Institutionalization is inevitable. He will likely be moved to residential care, which I know from experience working in that field separately, that it offers an abysmal level of comfort and support compared to self-direction. The workforce will also collapse. Dedicated caregivers are being pushed out of the field, myself included. I urge you to reject these DDA service cuts. Prove that Maryland values its most vulnerable citizens and workers who keep them safe. And just because I stayed for the testimony earlier from the panel of the Department of Health, I just have to say, Their testimony is highly ingenuous about the process and the benefits. We don't get any benefits. I have to buy my health care off the market myself. We don't get any support for it. If it's not in the budget, it's not approved. We might have been told in years past that we have budget authority or that our client has budget authority. That is absolutely not true. Every single change, every little incremental purchase must be pre-approved. Anything that we have bought ahead of time, they will not approve. They will just say, sorry, you're out of luck. Move on. And this profession is not free to enter. We get trainings that cost money. Yesterday, I completed the MANT training, which is awesome for my client because it was now a new requirement for DDA that they dropped out of nowhere with no ramp-up time for us to comply. They told us that we need to get this training done, so I did. And it cost me $250 to do so, out of my own pocket, which they will not reimburse. So I just have to say, I'm very disappointed with the leadership that they have offered such invaluable testimony about how they are steadfast that they are right, we are wrong, and that we just have to suffer for it.
Good afternoon, Madam Chair. Pardon me. Madam Vice Chair and members of the committee. My name is Michelle DeFeo, and I am here on behalf of my daughter, Madison. And she could not be here. She was here on Tuesday with two of her support staff pounding the pavement as well. Madison was one of the first 40 participants in the self-directed model here in Maryland. This model was designed to put individuals with disabilities at the center of the decision-making process, allowing them to build and lead their own support teams. Self-direction is unique because it creates stability. Participants recruit, hire, and retain the professionals who support them every day. As a result, Madison has had the same support staff for 20 years, 17 years, and 13 years. 2 of them were with her on Tuesday. That level of continuity is almost unheard of in any of the service models. These are not interchangeable workers. They are skilled team members who understand Madison's medical needs, her communication style, her routines, and how to prevent crisis. That stability protects her health, her safety, and her quality of life. If these proposed DDA wage cuts in self-direction move forward, participants like Madison could lose their longstanding team members. Decades of trust and experience could be dismantled overnight. And once those teams break apart, they cannot just simply be rebuilt. The self-direction model continues to absorb a significant share of reductions. Why are participants who have built stable, cost-effective teams being disproportionately targeted? Individuals with disabilities should not be unfairly singled out, especially when questions remain about funds that have not been fully accounted for. While this model centers participants and their teams, families often provide countless unpaid hours to sustain these supports. When systems destabilize, needs do not disappear, they just simply shift. I respectfully ask that you do not cut wages for self-directed support staff and do not reduce critical funding for all DDA service models. Protect the workforce, protect the participants, protect the stability that has taken decades to build. Thank you so much for your time.
Hi, Madam Chair, Madam Vice Chair, members of the committee. My name is Ann Valerbone. I'm the mother of Michael, a 35-year-old man with autism and developmental disabilities. I'm also a widow, so now I'm his only parent, not the plan. And I'm also have been his lifelong advocate. I am asking you to reject the Developmental Disabilities Administration's proposed $150 million in cuts, especially the disproportionate reductions to self-directed services. For 14 years, self-directed services has kept my son safe in his community. He depends on highly trained, long-term staff who understand his complex medical and behavioral needs. That level of care is not optional. It's what keeps him stable, healthy, and out of crisis. His needs do not shrink because the budget does. Maryland made a commitment to meet those needs. Federal CMS guidelines require services to be based on an individual need, not on budget shortfalls. For the record, in order for the $500,000 cap to go into effect, DDA would have to apply for a new waiver amendment from CMS and get approval prior to it going into effect. Cutting wages to experienced direct support professionals by 30 to 50% would never be tolerated for typical state employees. Why is it acceptable when it impacts people that cannot have a voice for themselves? We are not allowed to offer benefits. We are told we are, but they are never approved. They may be in his plan, but we can't get that money approved. We turn in a form and it never happens. Most of the time it just gets ignored, to be honest. We don't even get a rejection. If these professionals leave, and they will, services will collapse. That will not save money. It will drive people into emergency rooms and institutions, which cost far more and carry far greater consequences. Capping individual budgets at $500,000 will devastate those with the most intensive needs. That figure may sound large, but is far less than the cost of repeated hospitalizations or institutional care. These cuts do not reduce need, they shift costs, and they risk lives. Please stand with Maryland families and participants and protect self-directed services. I have one question. Why does the DDA take so long to file the appeals? We know at least a dozen participants. I'm part of Concerned Citizens for Self-Directed Services. We know at least a dozen participants who have been waiting on appeals. The Olmstead Act, which is a federal rule, requires that the appeal be heard and decided upon within 90 days. So if people are waiting over a year to get a hearing date, DDA is out of compliance with CMS. That risks funding, period. Risks all our funding. Anyway, and my final comment is no state has ever lost their federal match because of the cost neutrality rule. They've lost federal matches, but not because of the cost neutrality rule. Thank you for your time.
Hi guys, good afternoon. I'm here today again for the second year in a row as a sister. I think some of you guys might have met my twin sister. Unfortunately, she couldn't come here because Annapolis does not provide enough parking for anyone, let alone handicapped individuals. She also successfully got a new power wheelchair, which also just means it's one more barrier to access everything. And quite frankly, I'm a little bit frustrated this year, and I'm a little bit angry that we are here again, and we are now pressuring families to drag their loved ones that struggle to function every day, struggle to put words together. It is painful to watch this unfold sitting up there. It's painful. It's disgusting. I don't know what to say. Who made this plan? You all are sitting there. You know that this won't work. You know that no other industry would ever tolerate this at all. These are professionals. These are people. They are humans. Why is the head of this administration agreeing to a budget like this? You guys already know that there's issues with this. The analysts know that there are issues with this. You haven't gotten accurate numbers in years, and you're finally getting them. You're finally asking correct questions to get to the bottom of them. I think that's great, but it shouldn't come at their expense. I'm frustrated because I could have told you this was happening 3 years ago. There are models. There are proven ways to deal with this. There are so many. A lot of the people behind me will tell you, I've said this stuff verbatim for 2 years. Why is it taking us so long to figure this out? There are better ways to do that. And I don't understand why you don't make people go under oath up here. I've got a ton of questions. Like, I really don't. It's not rocket science. We're constantly worried about, are they incompetent or do they just not care? Like, we don't know. We don't know.
Ma'am, I need to just step in. I'm so sorry. I know passions and feelings are super, super valid and high right now, but we really do try to maintain a culture of respect in this committee. Please, please, please try to not call people incompetent. That's not kind. Let's restart.
Okay, all right. Yes, I feel like we need to start solving some problems and stop dragging our loved ones up here to plead for their staff. They get 2 minutes and they spend half of it struggling to talk about their staff, not even themselves. It's ridiculous. And these problems can be solved, and we do have resources, and there are plenty of really good people here. I watch all of you guys all the time. There are so many issues that all of us in this room have to worry about. We're all concerned about our kids. I'm trying to take care of my sister. I got 3 kids of my own. I've got an electric bill to pay. I'm 35, single mom, okay? None of us are getting rich here. We're just trying to make it. And there's a lot of really smart people in this room, and if they listened to us, they could solve their problems. They're pitting 2 models against each other by intentionally not explaining how the models work. Because I'm sitting here thinking, what is going on? Welcome to our world, traditional model, where we don't get stacked services. We don't get more than what we can absolutely prove that we need. Utilization should be 100% because we have to prove down to the nitty gritty that you absolutely need it beyond a shadow of a doubt. And it doesn't make any sense. Why are we pitting 2 sides against each other, conflicting with how to try and advocate and fight for their parts of the budget? Every part of it's needed. And we've got an aging community. You guys have heard about this. These parents are struggling. What are we going to do when they start passing away? And their loved ones are still here. We don't have the capacity in this state to even accommodate these cuts and the catastrophic effects that could happen. We don't even have the capacity to deal with it. That's an emergency. Do you want people running naked in the street? I mean, do you? Do you want people being smacked and kicked and punched and bit and scratched? Do you want lawsuits everywhere? We can't keep doing this. This budget isn't even enough to cover what's needed, and you guys know it. I gotta calm down. I don't want to be here again next year. Nobody wants to be here again next year. And we can figure out these problems. We're trying.
Thank you. Thank you. I really do. I want to take a moment to really just thank all of you for your passion and your advocacy on behalf of your loved ones, the people in your care, the people you love so much. We really do genuinely appreciate it. And we know these are very complex budgets. We spend so much time behind the scenes, like meeting with all of you, talking to people, reading and learning and diving into all of the models, as do, I know, our hardworking agency staff too. So I know that this is really complicated and all of us care a lot about this. Most importantly, about the sustainability of the program for everybody. Recognizing Delegate Stanko for a question.
Chair, I want to go back to where you started and your lived experience in this, right? So as a provider yourself.
Yeah.
So your experience has been that whether or not on paper you can receive any type of real health benefits of any kind inside the budget, it does not actually show up in your outcomes. Am I understanding that correct?
Correct. So we were led to believe that we could put it in our budget and then it would be reimbursed. Essentially, the way that would work is I would sign up for health insurance. I would pay for it out of my own pocket. I would submit bills to GT, our provider, our FMSC, and then they would reimburse it. But that actually only applies to one employee at a time. They can deny it. They can ignore it. which they have done repeatedly for the one employee that has tried, and it only covers himself. It doesn't cover their spouse, their children, none of that.
Okay, thank you. Follow up to it. Michelle, it's great to see you, longtime constituent and friend in many different ways. Can we just talk about, because I know your situation very well, if the budget cuts go through with BLS cuts specifically, do you believe you'll be able to retain your staff based on those cuts?
Thank you for your question, Delegate Stanko. Well, I chose to be transparent with Madison's team, everyone on the team, because I did not want them to hear it from someone else. I do a lot of advocacy work, and they are around when I'm at the computer and I'm making phone calls, and I did not want them to hear, so I did let them know what was on the table, and they have said that they would have to leave. They have commitments. They've built their career with Madison. 20 years, I mean, since the fruition of this program. And the state came to us with this model and with the idea of this model. The state came to us and gave the definition of what this would look like. So we've been very blessed for Madison to be a part of this program. But yes, she would lose her supported staff.
When I think about terrible outcomes for the participant themselves, that is a dramatically bad outcome. So I appreciate you sharing that today and your story over the last couple of weeks and years I've known you. Thank you.
Thank you.
Thank you, Delegate. Thank you for your response. Seeing no further questions for this panel, thank you all so much for your advocacy. Thank you. We have two remaining witnesses on the list, Robert Baynard and Sarah Butts from Service Coordination, Inc. Sorry? Oh, I'm sorry. I apologize. I did call you. Yes, come on down. Come on down. Thank you. Thank you.
Good afternoon. Good afternoon, Chair Shetty, Vice Chair Jones, subcommittee members, and guests. I'm Sarah Butts, social worker by training and Vice President of Government Relations for Service Coordination, Inc., or SCI. SCI is a nonprofit organization providing conflict-free targeted case management services to people with disabilities and complex medical needs across the state of Maryland. We're serving 16,000 people currently. All DDA waiver participants are required to receive conflict-free case management. Of the approximately 19,000 total DDA waiver participants, SCI serves 12,000 of those individuals in our Coordination of Community Services program. That's roughly 60%, a little more, of the entire DDA waiver population. What do case managers do? Case managers are often the first point of contact with a person supported and/or their family. They manage program or waiver applications, assists with maintaining enrollment, monitoring health and safety needs, as well as development, coordination, and oversight of each person's individualized service plans or person-centered plans. We're coming here today to tell you that we're concerned with the proposed cost containment measures and that they could negatively impact people receiving services, threaten staffing stability, and increase administrative burden. CCS organizations like SCI are going to be on the front lines of implementing DDA's proposed cost containment measures, particularly the $500,000 individual budget cap. It's important to recognize that reducing budgets does not reduce medical complexity, acuity, or essential care needs. The state does not have a process to really assess acuity of this population, and the cost containment implementation will be operationally complex. We respectfully request continued and meaningful engagement with stakeholder representatives throughout the implementation of cost containment measures. We also ask the General Assembly to ensure that any cost containment strategy includes safeguards that protect participant health and safety, preserve due process, and provide transparency regarding impacts and outcomes. We wish to reinforce the importance of a robust service array for people with disabilities. Choice and availability of specialized service options are critical. Choice and options to ensure access to community-based care.
Thank you. Your time has expired, but would you like to complete your thought, please?
Yeah, I just want to also mention that in the DLS analysis, you saw that chart about CCS compliance. That's a complicated process whereby there's a participation of the person supported, their family, direct care providers, the CCS, and the department. That's a 90-day process. And it's not, the onus is not on one part of that system, the CCS. I looked up the person-centered plan manual this morning in preparation for this hearing. It was revised on February 3rd, and it's 42 pages of red line text. So this is an area where we need to make things more simple. There's complexity in the system. And so some of these charts are misleading.
Thank you.
Thank you.
Thank you. Next, please.
Good afternoon, or early evening now, Chair Shetty and members of the committee. My name is Rob Baynard, and I am the CEO of Opportunities Incorporated, a DDA-funded community provider of day and employment services to people across Montgomery and Prince George's counties. I'm here today representing over 165 people and their families that choose Opportunities, Inc. to support them with building skills that help them achieve inclusion in their daily lives. Many of the people that we support and their families don't have the means to join us here today, but we all share serious concerns regarding the proposed budget reductions for the DDA. It seems like the fundamental issue is not just the amount of the reductions, but the long-standing, ongoing structural and fiscal challenges within the department. And those challenges need to be addressed, but not in a way that harms people with disabilities or destabilizes the provider network that supports them. Two of this year's primary proposals, the cap on waiver service budgets and the revision on the dedicated supports policy, are expected to generate significant savings. However, both proposals affect many of the same people, those with the greatest needs, which raises legitimate concerns about whether those savings are realistic without serious consequences to health, safety, and access to services. There is also real concern that despite the outreach that DDA has engaged in over the last year, community providers, families, and advocates have not been meaningfully included in the developing of these proposals or any others that have come from the department. Those working directly within the system have practical solutions that could improve sustainability without jeopardizing services. We can't continue to experience a DDA budget crisis year after year. We need sustainable solutions that balance fiscal responsibility with protecting vulnerable citizens. I respectfully urge this committee to oppose the proposed measures and ensure the pursuit of alternatives that preserve the health, safety, and stability of those receiving services.
I'll be brief. I know it's late. Thank you for the opportunity to testify on the proposed.
Take your full time. It's okay.
Well, thank you for this opportunity. I do appreciate it. My name is Lisa Shames. I'm the parent of an adult daughter, 80, who has severe disabilities from her Down syndrome. She's nonverbal and is totally dependent on others for her basic activities of daily living. 80 lives in a group home with 3 other women who are similarly dependent on staff to meet their needs. The home is to have 2 staff to take care of everyone, and you heard earlier Rob Malone, a witness, who told you specifically what the cuts would do to group homes and specific individuals. The proposed DDA budget cuts would have a negative impact on 80's care and the care of the other individuals with intellectual and developmental disabilities. I've testified before this committee before, and I thank you for your prior support of this community. At that last hearing, I told you that 80's needs are complex. She relies on direct support personnel to administer medications at the right dosage and at the right time. 80's needs are also comprehensive. She even depends on people to help her brush her teeth. A cut to the dedicated hours policy would make consistent staffing more difficult. 80 and her housemates would be at risk for not getting continuity of care that they require. Government can and should play a positive role in assisting at-risk groups in our community. I understand there are fiscal pressures, but please protect services for people with intellectual and developmental disabilities. They are among the most at risk among us. Generally, 80 relies on her family and on a provider, specifically ARC PG County, to provide the necessary basic services, but ultimately they rely on all of you to fund those services. Thank you very much.
Thank you. Thank you so much for your testimony, all of you. Do any subcommittee members have questions? Okay, thank you.
Thank you.
Thank you. That is our final panel of witnesses, but I'd like to ask the department to come join us again. We don't typically do this in our subcommittee. Usually the proceedings are that the DLS analyst does their thing, then the agency provides their testimony, and then we hear from advocates. Excuse me. But given the complexity of this budget and the number of additional questions that were raised in advocate testimony, we feel that it's important to bring you all back up to join us again. So we'll just turn it over to you all. You heard the same testimony we did.
Yep.
Please, if you can, share with us your thoughts, your responses. Thank you.
Absolutely. So I will start first with just a huge thank you. I know that many people have had to leave, but a huge thank you to everybody who came here to share their stories. I know that it's traveling here, it's being in this huge theater-like room and sharing your personal story, and that takes a lot of courage and a lot of effort, and I think it is really important, I think, for all of us to hear that, right? Because the advocacy is the heartbeat of everything that we do. And because ultimately, we really are, we do these roles because we want to serve our fellow Marylanders. So I just wanted to start, with that. I think one other thing that I want to acknowledge, I know that there was a lot of concerns raised around the eligibility and enrollment process. We hear that. I know that is something that we talked about yesterday in our Medicaid hearing, because this is an area where our Disability Administration and Medicaid Administration are working together to make improvements, because we absolutely need to have improvements here, and where we are looking at our staffing, having additional training and onboarding, as well as looking at our systems where we can have better interoperability of our systems to be able to have more seamless and automated processes as opposed to manual processes. I know we talked about, some of that yesterday, and just wanted to say happy to continue that conversation, with all of you offline, because that is a priority for us. I think, with that, I'll turn it over to Deputy Secretary Hutchinson to kind of walk through, some other very important points that, were raised from the testimony that we heard, and really appreciate, again, the opportunity to be able to bring all of us together to be able to hear together and, and discuss these really complex issues. Healthcare is very complex. The system is incredibly complex and hard to navigate. I think I can say that as a parent as well, navigating for my children when I say, wow, I have difficulty with this, right? The Secretary of Health. So, with that, I will turn it to Deputy Secretary Hutchinson to walk through, some of the themes that we heard.
Yes, thank you again for the opportunity to come back and talk with you all. Just wanted to touch on a few points that I heard during the testimony, and I too echo my secretary's sentiments in regard to thanking the advocates for not only just coming out today, but taking time out of their very busy and complex schedules to meet with my team and I over the last several months. First, I do want to correct the record in regard to one of the cost containment proposals that went into effect for self-direction, that it was mentioned that they did not all go into effect on July 1. And for the self-directed services wage exception, that cost containment proposal did go into effect on July 1. Having said that, even with all of the sustainability proposals that went into effect for fiscal year 2026, we remain confident in our projections that accommodate for our fiscal year 2026 budget. The other thing that I would like to address is the comment around the engagement of the MidSec members and they're being blindsided by the sustainability package that the department put forth. We talked about the two primary cost drivers, as I mentioned in my earlier testimony, that being personal supports on the self-directed services side and dedicated hours on the residential side. And as I also replied to Delegate Stanko, the original purpose of the MidSec, we pulled together out of 200 applicants, 22 members that were vetted by external partners with the health department. And so we selected 22 individuals, statewide representation, both service delivery models, because we value these service delivery models within our Community Pathways waiver. We did this so that we could make certain that participants, families, providers, and everyone around the state, regardless of region, would have a voice at the table to help us think through the very complex situation that we're in this entire state's fiscal climate. So with the conversations, while the MidSec did not formally put forth suggestions, because the department did respect the position that would have put them in as advocates, we talked about all of the challenges associated with the primary cost drivers. At each meeting, which we started on October 7th, and we had weekly meetings with the MidSec, we provided data to the MidSec members based on requests for exploratory options or considerations, I should say, for the department's consideration. I am happy to share those decks with this committee at a later time. Another thing I would like to speak to, because I do understand that with the self-directed services delivery model, the employer is the employer of record. The department does not serve as the employer of record. So in regard to benefits, this is a Medicaid waiver program, so this is health insurance. In regard to benefits, participants elect to provide benefits to their employees. They serve as the employer of record. And so there may be instances in which participants are not providing health benefits by way of this health insurance package to their employees. That is not the department's decision. There have been instances in which the department did receive a request for something like AFLAC, which is inappropriate for the department to approve as health insurance. So I just wanted to set the record straight on that. The department is not the employer of record, the participant is, and the participant has the option to provide benefits to their employees. Last but not least, in regard to the red line text that we have provided our case managers, I do want to echo that it is a partnership with our case management entities. They are the department's eyes and ears. They are working very closely with the participants and their teams to develop person-centered plans and to also monitor the health and welfare of the program participants. The document that was just referenced is a document that is in draft as a result of the department working very closely with the case management leadership on future service level agreements. And so we've been having this conversation with the case management leadership as we understand we need to do a better job at the department as well as all of our agents. So this is a collective effort with the case management leadership to establish expectations and metrics with for all of the case management agencies. We are doing this, again, to streamline processes, establish metrics, reduce administrative burden, and make certain that the outcomes for our program participants are favorable. And that concludes my comments.
And I will just say again that, like, I think, you know, and I think Chair Shetty, you opened up with this. This is a continuation of the conversations that we have been having, right? I mean, these are proposals that are being put forward. We have the issues around the cost neutrality and the waiver and sustainability that we need to address. And really the goal is to be able to have that dialogue, that this is kind of the starting place, and we really look forward to continuing the conversations, you know, with all of you, and we will continue to meet with the, you know, community as well, so that we can continue to work together on all of this.
Okay, thank you. I know I have a couple of extra questions, but I see that some members do as well, so I'm going to ask Delegate Stanko to go first.
Thanks, Madam Chair. Just touching in on the healthcare piece, from my understanding in there, or the potential participant that can offer that as a benefit. Just in the context of assumption, I have a child with a disability. I'm new to this program. I hadn't heard about it before. However you want to think through that context. How does is there a process that's really well established to help participants figure out how to put that person into the healthcare or offer that benefit if they want to offer that benefit? Just given the fact that we heard today that there's at least one person here today that has had struggle with that, and mentioned that his participant had tried to do that directly. So, like, what does that look like? The process of helping them navigate, including that.
So sure. Again, conversation with the case management entity, as well as the participant support broker. We provide technical assistance and guidance to support brokers, as well as the family by way of the policies and procedures that we have within our service delivery system. But it's really because the participant is the employer of record, and in some instances, the participant has budget authority. It's really on the participant and their team to come together and work on a person-centered plan that would help the participant achieve its goals and outcomes. We have this information also readily available on our website in the interest that anyone is interested in self-directing their services as well.
Do you have any data that says by chance has been studied, the average time that a self-directed person is in the participants in the program, and when they have a support person that elects to receive, or they elect to provide healthcare to that person? So in the context, for example, I'm a new participant, or my child's a new participant. I'm learning the process, helping them through it, getting enrolled. I don't know about this, so I'm not able to share it with them for them to provide that person-centered plan for me to have healthcare, versus someone that's been in the program for 10 years that has had an opportunity to learn and navigate the program. And I think about the equity disparity question that Delegate Ruff asked, and how that impacts different communities as well. And if it's not, I think it would be something that would be helpful to learn as time can allow, even if it's over the next 6 months to a year.
Yes, sure. This is something we can certainly look into and get back to the committee in regard to as to whether or not we're tracking this specific data point.
Thank you.
Thank you, Delegate. Madam Vice Chair.
Thank you so much, Chairwoman. And thank you so much to all of you for coming back down. And I really wanted to Chairwoman wanted to give the opportunity to close this conversation. Let me start off by saying I represent the city of Annapolis and the surrounding Anne Arundel County area. And we are 377 years old. These streets were made for horses, and it is not easy to park or get around. And so thank you on a personal note for doing so, bringing your families and advocating the way that you have. It's not easy. As I said from the top, I know your passion. You and I, we have sat, we've talked privately, I've talked publicly, so have you, about how important this is. But you heard it today, right? All of the meetings I had shared privately that I've had. Pure fear, frustration, anger, curiosity over when and if we'll hear back on things. Again, I am a partner in this work with you, but there are a few points that we have to figure out what the disconnect is, and I don't think it's that's set aside from the budget portion, right? We have policies and procedures that there's just seems to be a disconnect when we hear from constituents saying what is happening in the self-directed families and what they're experiencing firsthand every day. And that is a place I really look forward to working with you on, because we're not hearing back. I wrote down some quotes that I feel it's important that I have to repeat. Regarding no benefit is ever approved. We heard so many folks say we never hear back. Response time is months with no one to speak to. Appeals take forever. I never hear back. So in any and all ways that we have the best intentions, right? We have these policies, we have things on the website, but somehow it's not making it to the families, and there is a radio silence that is painful. And I look forward to figuring out how we can find where that is in the middle and fix it, because the frustration is just so much. So I want to thank you again. We have a lot to work on together. I'm here. I'm a partner with you. But let's, yeah, thank you so much.
I want to echo the comments of my colleagues and just raise that on my end, one of the things that I flagged from the advocates' testimony that I think is very concerning is in the FY26, this current budget year negotiations that were so difficult and we all worked so closely together on, that two particular components that the legislature, really put a lot of effort and work into seem to have been implemented, at least from what we're hearing from advocates, in a very different way than what was legislatively discussed. And so, flagging the day-to-day administrator and the dedicated hours implementation as the two that we heard the most about from our advocates today. I really want us to have some continued conversation on what's happening, please. I want to see the data from DDA on what's happening that can help me understand a little bit more, help our committee understand more about FY26 numbers and what the advocates, how does it line up with what the advocates are saying, please? Especially as we're going into the discussions on this next budget year. I think any time that we are, right, our budget is really vast and challenging, and we have so many amazing things that our state invests in. But the most important thing it invests in is our people. And we do it in so many different ways. And as you know, Madam Deputy Secretary, through the many years of service you've had in this role and in our state service, and Madam Secretary, in your role as well, and the entire DDA team, like, this work is absolutely critical to so many individuals and their families, and I know you care deeply about ensuring the sustainability, but also making sure that we're doing as little harm to people as possible. And so it's really important to us as a committee to make sure that we have a really solid understanding, and that both, like, the committee, the administration, and the advocates are all on the same page on what the potential impact could be of these cuts, so that we can really try and figure out how we could minimize harm. And so with that, I want to thank you so much for allowing us the opportunity to skirt a little bit of our typical procedure, having you join us again, share feedback, take a second round of questions. I know that's not usual, but really appreciate you all being willing to do that. Thank you for being willing to do that with us today. And most importantly, thank you to the advocates who have come today to share your stories with us. We have heard you. We are listening, and we are working with you, with our partners in the administration. So thank you. Meeting is adjourned.